and it's mentioned in your Cram Hub below. But we have an offer to pay for somebody's AP Psych test. All you have to do is post about your Fiveable experience, tag and follow at Think Fiveable, and we will select winners based off of the people who quote make us LOL. So very, very excited. It looks like I think 2 people will select. Oh, maybe I could be wrong about that. I'm not exactly sure. Several students will win each week. So several means more than 2. I'm not exactly sure, but a lot. Cool. All right, this is our larger team. You've met us all. You know us all. We are actually all here for you tonight. I am thrilled to say we have some people kind of coming and going at different points in time, but we're going to have a whole team, all hands on deck for you tonight. But particularly, we are looking at leads from Sean is leading, Selena is leading, and then Yoongi will be leading. And then we've got some co-hosting help from, let's see, we've got co-hosting from Rakesh and Christina, and then myself as well. And then in the chat tonight, we have Amy, and we have Zoe, and then Yoongi will be up there for a little bit. And again, Christina will be coming in and out. So we've got a whole crew for you today. Rakesh is wondering if you missed him. We're so thrilled to have him back. He probably had a ton of fun at prom, I'm sure. All right, so let's get into exactly, like I mentioned, today we are doing FRQs. We're going to start there with Yoongi and Rakesh and Sean. And then we're going to do clinical, and then we're going to go to social, and then we're going to do that all units practice test. Right now, I'm having trouble bringing it down in questions because there's just so many questions that we want to ask you guys. But we're going to try to get some good questions up there for you. All right, let's bring Yoongi and Rakesh down, and we're going to start with our FRQ tips.
Thank you so much, Jenna. Woo, we're so excited to get into FRQ tips for you all tonight.
Hello, everyone.
I think Rakesh might have gotten booted from the crowdcast, but the 2 of us can hold down the fort till he gets back. So Yoongi, why don't you lead us off?
All right, so real quickly, we're going to be going over FRQ, the research design, or also known as experimental. And we're going to have a practice one that you can follow along, as well as teaching you just how to interpret data, go and answer, and most importantly, get all 7 points. So take it away. All right, so our experimental question, I don't see Rakesh anywhere, but that's okay, is a study was conducted to investigate the role of framing on concern for smoking. Each participant was randomly assigned to one of 2 conditions. In the first condition, the participants read an article indicating that smoking led to cancer. Participants in the second condition read an article indicating that smoking can be used for stress relief. All participants were then asked to indicate how important it would be for them to not smoke. The results are presented in the table below. So usually all experimental questions or research design FRQs will be in 2 parts. Part A, explain how each of the following plays into a role of this eating behavior. That should be smoking behavior. And usually that will be a mini paragraph, kind of like the conceptual FRQ. And then part B is that operational definition. So dependent, independent, and then a couple of other questions. Remember, there will be 7 that kind of make you think about the data in your table or what's on your graph, and you have to show that you can accurately analyze said data. So let's get into it. All right, so how do we answer? So this is a little bit different than the conceptual FRQ in the sense that you're going to be operationally defining terms, but the same thing goes. SOTA, spacing, order, define, apply. Most importantly, correlation does not equal causation, and they will try to trip you up on this all the time. It is only an experiment if there's random assignment, so remember that. You must include all topic sentences and then call back to your stimulus. This is very, 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 very important. Tell them you know what's going on in your graph. Tell them you know what's going on in your data charts. Tell them exactly what you're thinking, and that is the best way to get the points.
Now, Yunji and Rakesh, can I actually ask you guys a question real quick about correlation and causation? So I feel like I hear the term correlation doesn't equal causation all the time, but what does that really mean? Like, can you guys tell me a little bit about the difference between what is correlation, what's causation, what each of them means, how we measure each of them differently?
Absolutely. Rakesh, do you want to try, or do you want to boot it off to me first?
I would like to just start off, and I think you can follow up on me. But so there was actually, just to connect with this, there was this really interesting graph that I saw, and it was basically like the number of movies that Nicolas Cage starred in versus the number of people who've drowned in a swimming pool. So I saw that graph, and you can see in the graph, as there are more movies that Nicolas Cage starred in, you can see more people drowning in pools. So people can kind of come to the conclusion that Nicolas Cage is the cause of people drowning in pools, when that is actually not true. So that's where you need to really understand what are some other confounding variables that can affect this. Like, how can we fully trust this graph? And Yoongi, if you'd like to explain more about that.
Before that, that is a wonderful example of correlation that I actually heard in my research methods class. We talked about eating ice cream in the summer and homicide rates, which shockingly, if you confounded correlation and causation, you would think that eating ice cream causes people to kill more people, which is not true. But yeah, Yunji, I'll kick back over to you to tell us a little more.
Homicide and ice cream? That makes me so sad. Maybe that confounding variable is it's hot. And as we know, heat makes us do crazy things. So correlation is kind of like how strong in your graph that relationship is. And then causation is kind of like a relationship between the two variables. So that correlation, if you had it's usually like a graph that looks like this, and there's a line. If it's let's say it's again that ice cream and then the homicide, and it's going up, and as well as temperature and then ice cream sales, that would be your correlation. Your causation would then be, oh, because there's more ice cream, there must be more murder. But again, that's not the case. So remember, correlation does not equal causation. All right. You want to take this one, Rakesh?
Okay, of course. So how do you answer for your response question? So first, you have to apply concept. And you must always remember that College Board recommends when you add in studies and like examples, especially, just state the purpose. So just don't add them because you know them. You have to kind of say why. In other words, make it meaningful and add it in. Same thing with the imagination one. That's something we talked about in the previous cram. And that was like, just add things when you know it's going to support your argument. And to finish off this slide, it's just making sure that you're confident in identifying operational definition, hypothesis, dependent, independent variable. And also, I think it's not added here, but also like confounding variables, because I've seen that come up on a lot of FRQs that I've been taking.
Yeah, especially state a confounding variable if it doesn't specify if your research design FRQ is in an experiment or is an experiment.
Also, really quickly, there's also been a lot of times where they ask you to like say some flaws or like how you fix flaws. So I think that's really helpful when you're looking through these FRQs too. So just knowing what are maybe some ethical flaws. These are all things that they'll probably be asking you for too. So that's stuff you could know.
Definitely know your APA stuff like the back of your hand, because most of the time they will actually, like 90% of the time, they will call upon like, was this experiment ethical? And then you're going to have to think, if it's the little Albert experiment, for example, you're going to think, no, it's not, because there was no debriefing. There was no protection of the said person, and it was traumatized. So.
Yeah, you need to know how it wasn't ethical too, which are great examples you pointed out. And I personally love the experimental FRQ question because it's so important that we're learning how to be good scientists in the world.
All right, so let's look at how we break it down. So part A, again, that's kind of like that mini essay, mini paragraph part. Usually you will be given, I think it's like 3 or 4 terms, but for this example, just because we want you guys to follow along, there's 2. And you have to take all of the terms and relate them into the question. Most importantly, you want to make sure you have a topic sentence, and then you have a sentence at the end that just ties everything together. And always make sure, since this is a paragraph, that you underline each term, because you don't want your reader to get lost in what you're saying. Anything to add, Sean? All right. Let's see, part B. So this one is a little trickier just because maybe some of you haven't seen like operational definition yet. But essentially, they will ask you to operantly define either the independent, the dependent variable, and then they'll have a couple other questions relating into that data table. So remember the define and apply part of SOTA, and this is kind of the example that we have up here. And it still applies for this one that you want to do the space, and you want to go in order of what they ask you. So I think we're good here. If there's anything else you want to add, we have a quick Q&A just to answer some pressing questions. But honestly, make sure you just practice that FRQ, just run through it. And honestly, that will give you all the confidence that you need.
Can we actually, can you guys give me a couple examples of operational definitions? I know we talked about it the other night, but that's one of those trickier things that I guess it's good to just get another refresher on.
Okay, so the operational definition, it sounds tricky, but mostly it's the measure of something. So let's see, I need to find a good. Okay, so let's think in terms of anxiety. That could be in terms of a test score, and the withdrawal from a situation, or the activation of like the sympathetic nervous system. Essentially what the operational definition is going to do is going to say, because of this anxiety from this test, stress levels went this way, or like they increased this way, and that is the cause for whatever. It's like it's really hard to explain out loud.
No, I totally understand. Yeah, and kind of using that stress level example. So in an operational definition of like stress levels could be people's cortisol levels, because we're using cortisol levels to measure the stress in somebody. So I know I talked about the other night, there's kind of like 3 key levels to designing an experiment. You need a construct, and the construct is the abstract concept that you're interested in. So intelligence, happiness, stress, stuff like that, like abstract concepts that we want to find a way to quantify. If I asked, how stressed are you? That's not really giving me a good measure of how stressed you are. So from there, we have our second level, which is variables, and those are what we manipulate, those are what we measure. And then our operational definition is kind of what connects the two. It is how we measure this abstract concept, like the definition we use to measure this abstract concept that doesn't really have a definition as it is. So for example, IQ score would be, or if I said I'm using IQ scores to measure intelligence, that would be my operational definition. Or I'm using cortisol levels to measure stress. Or I'm using number of smiles to measure happiness. It's all these things that you can count, and then the construct that you're measuring, that gives it the operational definition.
Yeah. Thank you, John. I'm very bad at thinking on the fly. We have what if there's something we don't know on an FRQ? Okay, these are my favorite. Always make sure you leave a space, because remember, you got to go in order. But if you don't know it, just write something. And honestly, it's going to be in your favor to put something down than leave it blank. And as long as you write and you write and you write, you're going to hit it somewhere, or just take your best guess don't get penalized for guessing. So I would definitely do that.
Another thing I love to do with the FRQs too is if you really don't know what a word means, like take a minute to like look at the word and see if you can make something of it. I'm trying to think of a good example of this, but like compliance. If the FRQ asks you about compliance, and I might not know exactly what it is in the context of psychology, what does compliance mean in our everyday life? And usually you can kind of get an idea of that. Same with like dependent variable. The independent variable or the dependent variable is what it depends on the independent variable. The independent variable is the thing that changes. It's the thing that's like absent, that has that the dependent variable doesn't necessarily impact. So those are just like other little tips, like think what does the word mean in English in our day-to-day life, and like how can I kind of connect that to psychology and the brain and what I'm thinking.
I saw someone ask, like, should we absolutely go in order to the questions that are presented? Yes, because the person that is most like grading your FRQ is a AP Psych teacher or a psychology professor that's been locked in a room. They're jacked up on coffee. They don't want to kind of like have to filter through. So stay in order. Always stay in order.
Yeah, I'd like to add on a little because exactly what Yoongi said, my teacher told me to always stay in order because you don't know whether your FRQ is going to be the one that's graded first when they're like attentive, they don't even need any coffee, they're like ready to just grade, or if you're at like the end and the grader is just like done with psych, they're done with seeing the same FRQ like 5,000 times graded
End.
1,000 different ways. So just keep it easy for them is going to make it easy for you to get those points.
I also saw one that, could you more clearly describe a space, please? Okay, so you're gonna, I've never actually took one on paper, but I know that there are lines on the paper. That space is saying skip a line because you want to keep everything like neat and separated. So that space is just like underneath vocabulary term, define, apply, space, underneath vocabulary term, define, apply. Let's see. I like the term skip. Yeah, or skip a line. Let's see. Should we leave this bit? Yeah. Mm-hmm.
I think I see one that just popped up on the screen. For the operational definition, would we just state the facts from a statistic or graph provided, or do we have to make it up? In operational definition, you shouldn't really need to make anything up for. Like kind of what we talked about, the operational definition is how you're measuring the construct that you're interested in. So if the question says we are interested in observing happiness, and then you look at the graph and the plot is number of smiles, you know that this abstract concept, the construct of happiness, is being measured on the graph by the number of smiles. And therefore, you can find your operational definition of we are measuring smiles we are measuring happiness based on how many times you smile. The operational definition should be something you can count. Cortisol levels is going to be a number. IQ is going to be a number. Number of smiles is going to be a number. So all kind of things like that for operational definition.
Yeah, sometimes on FRQs they don't give you like they just ask you for the operational definition. In that case, I always tend to go towards like like you said, the number of smiles. Like it needs to be a way that you can quantify something that's not really quantifiable, like happiness. You can't really
exactly
say I'm 5 happiness today, like I smiled 10 times today, like so just try finding a way. You could do like a survey or like the number of like candy children took for Halloween, something like that. So just be able to quantify a concept that is not really quantifiable.
Awesome. And then I saw another question pop up for a second, but it went away pretty quickly. And I think it's a interesting one to address with everybody. But it was about p-values and when does the p-value become significant? So do either of you guys want to take that, or do you want me to explain p-values?
I mean, it is completely up to you, but I mean, there's usually with p-value, I don't know if any of you have or remember seeing the graph, but it's defined as like the probability under the assumption of no effect or no difference. So nullification of the hypothesis of obtaining a result that's like equal to what you've stated, or it's like more extreme than what you actually observed. So kind of think of it as like it's a scale, and that's when it becomes relevant. Only when it's equal or it's more statistically significant.
Awesome, yeah. And if there's one thing, I don't know if this is on the AP Psych curriculum exactly, but as potential future psychologists of the world, a p-value is the probability of your data given the null. So what that means is how likely is it that the data that you got was by chance, pretty much. And what our p-value is, it's a value between 0 and 1. And that's saying what are the odds that there was the relationship that you observed was observed by chance. And as psychologists, we're willing to accept that 5% of the time it might be due to chance. And that's a risk we're willing to take, especially in a field that usually has very low correlations. And so what we do is anything that is, when we get our p-value, when the p-value is less than 0.05, that is basically saying that there's a less than 5% chance that this relationship that I observed was due to chance. So if the p-value is greater than 0.05, we accept the null hypothesis. And the null hypothesis pretty much means there's no relationship or there's no significant effect. If the p-value is less than 0.05, we reject the null hypothesis. So yeah, usually when we find a p-value, again, just general tip, it's usually like a lot lower than 0.05, and it's usually considered p-hacking, or psychologists' research is called into question if a lot of times it is very much like close to that 0.05 threshold, because there's a lot of researcher degrees of freedom. But yeah, so that's a little bit about p-values. If there's one thing to take away from p-values, it is the probability of the data given the null.
You go over the point distribution for FRQs, my bad. Okay, so each free response question in total is worth 7 points, and that's because you will have 7 terms for each. Now there's this little magical number, 3.57, and that is what your FRQ, each point is going to be multiplied by to add into your raw AP exam score, and that's 33.3%, but you don't have to worry about. What you want to be aware of is that because it's 1/3 of your entire exam grade, for each individual term, you're going to get 1 point. And it's either you get that 1 point in the 3.57 or you do not. So always make sure you try to add that apply and the define and an example if you don't think you hit one of the two.
Thank you, Yoongi, for that. I'm looking through the chat and I'm seeing a couple of people mixing up G factor and p-value. So just to clear up some stuff, also sorry if there's background noise, there's like a whole thunderstorm going on right now. But the G factor is not stats related. That is intelligence related. That's Charles Spearman. That has nothing to do with stats. So don't worry. G factor, nothing related. But P factor, yes, that is. And also in stats terms, you're only going to be dealing with baby stats. That's what my teacher calls it, like baby stats for the psych exam. So don't worry about having to like calculate the p-value and describe and interpret it and all that. Just understand what it means and try being able to put it in context.
Yeah, I guess the key takeaway from P is if it's less than 0.05, reject the null hypothesis, your relationship is significant. Cool.
Right.
I think with that just about brings us to the end of that unit. Let's bring up Selena and talk some clinical. Bye, Yoongi. Thank you so much for our FRQ help.
You're welcome.
Hello. Okay, so what we're going to be going over right now is Unit 8, which is Clinical Psychology. And just to remind you guys, this portion of the AP curriculum is a huge part of the AP exam, 12 to 16%. So yeah, with that, let's get into it. Okay, so before we get into it, I want to remind you guys to please treat this topic with respect, as we're talking about something that's very sensitive to others, or like family members or people that are close to you. Okay, so for this slide, Rakesh is going to begin with our intro.
Thank you. Also, on the note of treating this topic with respect, please do not self-diagnose or diagnose other people in this unit. That is really sensitive, so let's keep it clean. Okay, so let's start. Psychological disorders. So these are basically syndromes marked by clinical disturbance in cognitive functions, behavior, or emotions. They must be maladaptive, dysfunctional, atypical, dangerous, or distressing. You don't really need to know that, so that's why I didn't have a mnemonic for it. I usually have a mnemonic for everything. But so classification and labeling, the most important one is the DSM-5, which is the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. So this includes a diagnostic description and criteria, prevalence, suicide risk, and some other info, but it doesn't explain causes or cures. And also remember, labels can have downsides and the rise of biases. So a really interesting study that I'd kind of like to discuss about is the Rosenhan study. I don't know if I'm saying that right, but we're just going to go with it. So in this study, basically, Rosenhan and his colleagues pretended to hear voices to get admitted into a psychiatric hospital where they were diagnosed with schizophrenia. And after being admitted, they acted normally and they told people that the voices were gone, but the staff still continued to look at the behavior and call it abnormal. So through this experiment, you can kind of tell how biases sort to form even after the label is kind of diminished.
So yeah, with that wonderful introduction, we are going to get into neurodevelopmental disorders. And before we kind of get into the different disorders, I kind of wanted to go through some ways that you guys can memorize these disorders easier, because I know there's probably going to be a lot of questions like, how am I supposed to remember when there's literally like 100 disorders that are on the AP exam? So it's way easier to remember these disorders when you group them. So like neurodevelopmental disorders, they all have to do with like the brain or like cognition. So when you remember them in groups, they all have like kind of similar symptoms. So that's one way you can remember it. And another way that really helped me last year to get a 5 on the AP exam is I looked for like characters in like books or like TV shows that are like display similar symptoms. So every time I'd see the name of the disorder, I'd be like, oh, this person from this TV show or this book has similar symptoms. So yeah, okay, back to neurodevelopmental disorders. So these are disorders characterized by impairment in cognition, communication, behavior, and motor skills, and resulting from abnormal brain development. So some common conditions are ADHD, which is attention deficit / hyperactivity disorder. And this is a disorder characterized by extreme inattention and or hyperactivity. And then the next one, we have autism spectrum disorder, also known as ASD. And this is characterized by atypical behavior, interest, thought processes, speech, and interactions with other people. And for intellectual disabilities, so this is kind of a disorder where a person's ability to learn at an expected level and function at daily life is affected. And some requirements to be diagnosed with an intellectual disability is that the condition must manifest before you turn 18 years old. And an IQ below 70 can be an indicator that you do have an intellectual disability. So some causes of this are brain injury, disease, and other problems. And this does include ASD because you are born with ASD, or like it's passed down through genetics, so it won't be caused by brain injury or diseases or other problems. And more causes are exposure to teratogens or complications during pregnancy, which is also like linked to exposure to alcohol and tobacco and environmental risks while in the pregnancy stage. And then, of course, we also have genetics. Okay, next slide, please. So the next slide is about schizophrenia plus psychotic disorders, and these are disorders characterized by irrational ideas, distorted perceptions, and loss of contact with reality. And of course, the big condition that we're going to focus on here is schizophrenia, which is characterized by delusions, hallucinations, disorganized speech, and inappropriate expression of emotions. So there are two types of schizophrenia, and the first one is acute schizophrenia, which includes the types of schizophrenia that have positive symptoms. And remember, when we're talking about AP psychology, positive means you are adding something. It's not like, oh, positive, yeah, happy. No, it means you're adding something. So delusions and hallucinations are symptoms of acute schizophrenia because you're adding on these delusions and hallucinations. And then the next one is chronic schizophrenia, which is characterized by negative symptoms, which is like disorganized speech because you're losing that ability to speak in a way where other people can understand you. And schizophrenia is believed to be caused by a combination of physical, genetic, psychological, and environmental factors. And Rakesh will talk to you guys more about mood disorders and more specifically depressive disorders.
Okay. So mood disorders specifically are characterized by persistent sad, empty, or irritable mood. And you'll see that again when we talk about bipolar disorders. And if you're in our cram, you guys should have heard about that. So depressive disorders, let's talk about the main five. And then I'm going to go in a little more deeper into some of the causes because there's some highlighting causes that I think we should discuss. So we have major depressive disorder. That's the main one. We have disruptive mood dysregulation disorder, dysthymia. I'm so bad with pronunciation. Then seasonal affective disorder and postpartum depression. I'd really like to look at the last two because whenever, like Selena said, it's better to group them like mood disorders and depressive disorders instead of trying to memorize each specific disorder's symptoms and causes. But in this case, there's a couple like seasonal affective disorder that is really specific to there's one main cause, and that is a specific season. And what happens is when you maybe like winter or summer, people tend to start feeling a loss of interest and depressive symptoms. And after that season is over, like after winter is gone and the sun starts to come out more, they start feeling a lot happier and a lot more excited and it's almost like they're like the depressive symptoms are gone. That's pretty much how it is. But then the next time winter comes along, they start feeling that sad mood again. So with postpartum depression, the main cause is childbirth, as you may have kind of understood by the name. So this happens in women when after childbirth, there's a hormonal drop, and that's when they start to feel that same loss of interest. But some of these symptoms can be sort of directed at the baby as well. So they might have a loss of interest towards the baby. They might want to harm the baby as well. So this is when we'd have to intervene. Psychologists would intervene. And that's basically the point I was getting at. So while it is best to categorize disorders, when you see certain questions where they're like situational questions, like, oh, this person experiences this, what do they have? If you ever see something like, oh, it only happens in the winter, or they just gave birth to their child, just be sure just make sure you immediately go towards those specific disorders. And to quickly cap it off, potential treatments, we have serotonin agonists, so selective serotonin reuptake inhibitors, SSRIs, and norepinephrine agonists, which are also known as SNRIs.
Okay, so the second part of mood disorders include bipolar and related disorders, and these are disorders characterized by extreme mood swings alternating between manic and hypomanic episodes and depressive episodes. And we'll get more into what those are later on. So common conditions include bipolar 1 disorder, bipolar 2 disorder, cyclomania disorder, and you guys might be asking, how am I supposed to tell the difference between bipolar 1 disorder and bipolar 2 disorder? Well, bipolar 1 disorder only includes manic episodes that may be followed by hypomanic episodes, and bipolar 2 disorder only has hypomanic episodes. So a manic episode is more severe than a hypomanic episode, which is why bipolar 1 disorder is counted as more severe than bipolar 2 disorder, and a manic episode causes impairment in social functioning or occupational functioning, and it may necessitate hospitalization in order to prevent harm from yourself or to others. And there may be psychotic features, which include like hallucinations, maybe. And on to cyclomania disorder. This is characterized by emotional highs and lows rather than mania and depressive states. And this disorder lasts longer than bipolar 1 and bipolar 2 disorder. And a fun way to remember this is that little swirl like doodle I included in there. I remembered it because it's kind of like cyclomania. So it's like kind of like a cyclone. Some causes. These disorders are believed to be caused by a mix of biological and environmental factors, and some potential treatments are lithium with an exclamation point and antipsychotics. More specifically, the target is dopamine. So please bear with me because this is a massive slide. So anxiety disorders are characterized by distressing and persistent fear, also known as fear of fear, and anxiety and maladaptive behaviors that reduce anxiety. So some common conditions include obsessive compulsive disorder, also known as OCD, which is characterized by unwanted, repetitive thoughts, actions, or both. And then we have social anxiety disorder, which is an intense fear or avoidance of social situations. And then generalized anxiety disorder, also known as GAD, which is a disorder where someone is continuously tense and apprehensive and in a state of autonomic nervous system arousal. And then we have, last but not least, panic disorder, which is marked by unpredictable minute-long episodes of intense dread where someone can experience terror, chest pain, and choking, and oftentimes people worry about when their next episode will be happening, even though they don't know when it will be happening. Some causes of this are major life changes, traumatic experiences, and genetics. And then some treatments include cognitive behavioral therapy and anti-anxiety medication, and more specifically, CNS depressants. And an important symptom is panic attacks. So throughout all anxiety disorders, like this is a symptom that you guys should know because it is prevalent throughout all of them. And these are episodes of sudden and intense anxiety. And often in panic attacks, there will be a person will be shaking and crying and feeling disoriented. And then Rakesh is going to take this slide away.
Okay, so now we have behavioral disorders, specifically eating disorders, and these are characterized by the presence and persistence of unhealthy eating habits that impair physical and mental functioning. So whenever you hear on the AP test something about unhealthy eating habits, just immediately think about your eating disorders. So some common conditions, there are not many, it's anorexia nervosa, bulimia nervosa, and binge eating. And the causes, social environmental stressors, factors, and also some really cool data that I was looking at was that more people in the Western, like in the West, tend to have more people suffering from anorexia nervosa more than people from places like in Asia. And this is because, you know, in Western cultures, they tend to have a more, it's kind of like a social norm, like don't be overweight, don't be obese. And that's when people tend to start getting the symptoms of anorexia. So that's kind of interesting to know. Yeah, and genetics can also play a part in eating disorders. Some potential treatment are activities such as yoga, and yeah, I think that's it for eating disorders.
Okay, so on to behavioral disorders, and more specifically, addictive disorders, which are characterized by the misuse of addictive substances such as alcohol and drugs. So some common conditions include substance abuse, which is when someone is like overly drinking or overly using drugs. And then we have substance dependence, which is a little bit different because that person becomes dependent on those drugs to like live, or they'll go into like severe states of withdrawal. Some causes are social and environmental stressors / factors, and also genetics. Like if someone has a family history of becoming an alcoholic, then that person is also more likely to become an alcoholic. And then moving on to trauma-related disorders, these are disorders characterized by serious psychological reactions resulting from traumatic events or stressful experiences. And some common conditions include post-traumatic stress disorder, also known as PTSD, which is characterized by haunting memories, nightmares, anxiety, and social withdrawal and/or insomnia. And some kind of requirements to be diagnosed with PTSD include that these symptoms must last for at least 4 weeks after a traumatic experience. And please remember this, when it comes to trauma-related disorders, a lot of it stems from the amygdala, which is the fear center of the brain. So now on to personality disorders. So these are disorders where a person has long-lasting and flexible patterns of thinking and behavior that impair social functioning. So we have these split up into 3 groups, and first group is known as Group A, and all disorders under this group are characterized by odd or eccentric behaviors. And I'll be going over a few of these simply because we don't have time to like go over all of them in depth. So we have paranoid personality disorder, schizoid personality disorder, and schizotypical personality disorder in the first group. And schizoid personality disorder is where a person avoids social activity and shies away from interaction with others. So moving on to Group B, which are characterized by dramatic and impulsive behaviors, we have antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. And so I feel like a lot of you guys will remember narcissistic personality disorder the most, which is where a person becomes like extremely infatuated with themselves. And you guys can remember this because of the Greek myth where Narcissus falls in love with himself and stares at his reflection, but then kind of dies because he stares at his reflection so much. So yeah. Okay, moving on to Group C, which is characterized by fearful or anxious behaviors. And in this group, we have avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. So you guys might look at the last one in that group, obsessive compulsive personality disorder, and you might be wondering, how is this different from OCD? Well, obsessive compulsive personality disorder, also known as OCPD, is a mental condition that causes an extensive obsession with perfectionism and organization and control. So the causes of personality disorders often stem from environmental factors and genetics, and some treatments include medications like antidepressants and mood stabilizers, along with psychotherapy. So Rakesh will take us on our journey of learning about treatments.
Okay, so I think this is the last slide for this unit, but for treatments, we have specific categories like therapy, medication. There's also biomedical treatments, so we'll just go over some of the main ones. There's behavioral therapy, cognitive behavioral therapy. That's a really important one, cognitive behavioral therapy. Exposure therapies, those are centered towards phobias, and rational emotive behavioral therapy, client-centered talk therapy. Something I would recommend that you know is a psychologist that sort of created these kind of therapies, and maybe like what each therapy aims to do. So that's kind of important to know. And medication-wise, we discussed this before: antidepressant, SNRIs, SSRIs, anti-anxiety drugs, mood stabilizers like lithium. We have antipsychotic drugs. A con for this is tardive dyskinesia, and this is when there's like a loss of movement, if I'm not wrong, and this is kind of like a side effect of antipsychotic medications. So others, we have electroconvulsive therapy. These are like the biomedical kind of ones. We have electroconvulsive therapy, RTMS, deep brain stimulation, and psychosurgery. This is when they physically actually like change your body to kind of adjust to, or kind of like reduce or like control your symptoms. And also, final thing to note is external factors like support systems, finances, social environment, and culture are equally important in treatment effectiveness. That's also why you see a lot of people not getting mental health aid, because the stigma surrounding mental health, which I'm sure your psych teachers have probably discussed. Jenna, if there's anything you'd like to add.
I was typing an answer into the chat, so I missed the lead-in question. Can you repeat that?
Oh, I was just asking if there's anything you wanted to add.
Yeah, can you tell me what you were talking about beforehand? Because I was just typing about OCD, so I missed what you were talking about beforehand.
Oh, I was just finishing up on the biomedical kind of treatments and external factors.
Yeah, so like antidepressants. I think when it comes to the like psychopharmacologicals, we're really targeting very specific neurotransmitter systems with these. So our antidepressants are primarily going to target serotonin. Sometimes they'll also target norepinephrine. So SSRIs are our selective serotonin reuptake inhibitors. They are serotonin agonists. We're going to talk a little bit more about agonists and antagonists tomorrow in our Unit 2 review. But just remember that agonists increase the availability of that or the action of that neurotransmitter, whereas antagonists decrease it. So what our antidepressants do really is increase the bioavailability of serotonin, and then sometimes in combination with norepinephrine. Our anti-anxiety medications, those are central nervous system depressants. So they actually slow down the activity of the central nervous system. And they do this by binding and acting on our GABA receptors. So by increasing the activity of GABA, which is the primary inhibitory neurotransmitter of the central nervous system, when we increase an inhibitor, we get more inhibition. So that's how anti-anxiety medications work, is through, by suppressing the central nervous system. We have our antipsychotic medications. These actually target dopamine. So our dopaminergic systems are pretty much overly active in things like schizophrenia, for example, as well as bipolar disorder. So antipsychotic medications are commonly used for those two psychological disorders. So again, schizophrenia and bipolar disorder. One of the things about using antipsychotic medications, though, especially first generation antipsychotic medications, which only target dopamine, is the syndrome of tardive dyskinesia. Now, tardive dyskinesia occurs because dopamine is also responsible for other functions in the body outside of just things like reward and euphoria. And I'm sure you guys can put it in the chat, but I'm totally behind on it. So that would be movement. So tardive dyskinesia is actually a movement disorder characterized by specific facial movements and then trunk and limb movements when we use medications that inhibit dopamine. So there's actually those second generation antipsychotic medications that target more systems than just dopamine. I believe it's dopamine and serotonin. And tardive dyskinesia is much less common in those individuals that use those medications. So there's your little deep dive into psychopharmacologicals. Rakesh, were you gonna, is it the next slide or are we keeping going with others and remember?
Yeah, I think it's the next slide because I just wanted you to go deep into that.
Look at that, we're at our Q&A. So I know there's a ton of questions in the Q&A tab that we're gonna get sent up to our screen. And then I'm also gonna try to dig through the chat that's right here. So I'm gonna try to dig through the chat while Selena and Rakesh, let me know if you want me to tackle any of these questions.
Yeah, okay. I actually saw someone had a question about what is histrionic personality disorder. And so basically I wanted to go over that. It's a disorder where one seeks attention and talks dramatically with strong opinions and is also easily influenced by others. I saw someone also put Regina George as an example of this, and I thought that was really funny.
There was this really good question that I saw, which was, what is narcissism versus egocentrism? And I just like to say egocentrism is a development thing. See, development does come in handy. Egocentrism is mainly seen in children when they're unable to take they're unable to look at things from the perspective of others. And a cute little example of this is actually it was in my psych textbook, and it was when this little girl, she was playing with like memory cards, and she was showing her grandpa like, here, I got a match. But the thing was, like, the match was facing her, so her grandpa couldn't see the match. That's basically what they're trying to say. So they really can't tell. They can't understand things from other people's perspectives. So this is, and the thing with egocentrism is it goes away. So they start to understand things, and they're able to empathize by around age 7. But narcissism, that's a disorder, so that's really important not to get that confused. And like Selena said, that really nice Greek myth. So yeah, just know egocentrism is not a bad thing. It's seen in children, and it's a development concept.
Okay, I also saw a question where it asked what's the difference between schizoid personality disorder and schizotypical personality disorder. And so schizoid personality disorder is more of a disorder that's characterized by, like, you don't want to be like part of social relationships, or you try to stay away from social activities in general and interactions with other people. And schizotypical personality disorder is more of a discomfort in close relationships and not really relationships in general.
I think another question, this is kind of back to Unit 5, but I think we can just quickly go over that. It was about the difference between internal and external locus of control. So I'm just going to go over that quickly because that's not super relevant to Unit 8. But internal locus of control is believing that actions are caused due to yourself. So thinking like, if I study, I'm going to pass this AP exam. But an external locus of control is kind of like, fate, luck. Like maybe if I close my eyes or flip a coin and I circle in the right answer, I'll pass. So just think of external as in external factors, internal as in yourself, inside of you.
Okay, I see a question that keeps popping up, and what's the difference between histrionic and narcissism? So histrionic is like you seek the attention from other people. You're kind of like looking for drama, and you talk like, when you're talking very dramatically, it's also sort of like that seeking drama element. While narcissistic is like you're obsessed with yourself and you really don't need to seek attention from other people.
I also saw a question on rational emotive disorder. And so rational emotive disorder, that's basically where the therapy is centered on trying to understand irrational behaviors and trying to, rationalize those behaviors. So that's pretty much, I think you can understand that in the name too, like rational emotive. The question is right there. That's perfect. Also, electroconvulsive therapy. I'll just really quickly say that I think Jenna is way better at answering that than I am, but ECT is electroconvulsive therapy. And Jenna, if you'd like to go on.
Honestly, I'm actually not super familiar with most like therapeutic forms of treatment. My focus is more in the psychopharmacologicals. So I could absolutely dig up a wonderful explanation for you if you give me just like a little bit, but it's not something I'm super familiar with. But I can get you a really comprehensive answer pretty shortly.
Yeah, like basically they just they send electrical stimulations into the brain. So they're basically changing the the impulses that are sent through your brain. And this is mainly used to, uh relieve or kind of reduce symptoms. Like mainly these are for major symptoms, kind of life threatening. So these are to control those specific symptoms.
Okay, I think I'm gonna go over maybe like one last question before we move on. And a lot of people are asking to go over the difference again between OCD and OCPD. And so OCD being an anxiety disorder is more centered around anxiety. And I'm gonna repeat like the definition again. It's characterized by unwanted repetitive thoughts, which kind of makes up that obsessive component of OCD. And then also unwanted repetitive actions, which makes up that compulsive kind of part of OCD. And so it is more driven by anxiety, while OCPD is more driven by personality, like you as a person are kind of obsessed with perfectionism and having control over everything, while OCD isn't really like that. It's more like you having maybe an action that you need to do throughout the day, otherwise you won't feel comfortable with yourself. And then OCPD is just the overall like obsession with being perfect and having control over everything in your life.
Thank you, Selena. Really quickly before we end, another piece of data that I just realized was it was related to eating disorders, specifically anorexia nervosa, and it was that women it's more prevalent in women than men. I'm not gonna say why. You know what? I'm gonna keep it a question. So if y'all can explain why, throw that in the chat. And I think we can end. Oh, there is another question up there. Is alcohol fetal? I think it's fetal alcohol syndrome. I think they typed it wrong. An example of neurodevelopmental disorders. I've categorized that one in the development unit, and that's basically back to teratogens when a pregnant woman specifically drinks alcohol, and that sort of has a lot of physical and cognitive defects that start to appear in the child. And these are lifelong, by the way. These don't leave after a while. These are lifelong.
So, and then with fetal alcohol syndrome too, it's not technically classified as a neurodevelopmental disorder. There are neurodevelopmental symptoms, but it's technically classified as a congenital disorder. So, yeah, not quite the same thing, even though the symptoms inhibit similar areas. It's not technically a neurodevelopmental disorder. Any other questions that we can take? Oh, Sean is wanting us to further explain cognitive behavioral therapy. So CBT is just a form of therapy that tackles both maladaptive cognitions and behavior. So you can think of cognitions like ruminations, repetitive, intrusive thoughts. Negative cognitions could be like, for example, everybody hates me. Like that's a really maladaptive cognition. And then behaviors could be things like doom scrolling on your phone, for example. Now, obviously, all of these individually are not examples of like clinically diagnosable psychological disorders, but those could be symptoms of somebody's psychological disorder. So when we use cognitive behavioral therapy, what we do is combine changes in behavior. So when somebody wants to say, for example, doom scroll on their phone, their homework is instead to put their phone down and like walk around their block, just as an example. And then the cognitive component is challenging those maladaptive cognitive thoughts. So really like trying to take a step back and think, is it really that everybody hates me, or could it be something else? Taking a step to like laugh at that part of you that tells yourself that. So when we use CBT, we're really trying, it's like a homework type of therapeutic technique that really tries to get at both the maladaptive and negative cognitions, as well as those maladaptive and negative behaviors. So it's just kind of like a dual-pronged approach. Oh, maybe also explain SSRIs if we have more time. Okay, yeah, I can do that. So SSRIs are selective serotonin reuptake inhibitors. So on the neuron, within the synapse, on the presynaptic neuron, that means the neuron that secretes the neurotransmitters across the synapse, there's a protein embedded in that neuron called a transporter protein. And that transporter protein, basically all it does is once that neurotransmitter goes out into the synapse, it kind of like starts vacuum. I'm going to use this as a analogy. It kind of starts like vacuuming it all back up. So it takes in all of that serotonin back into the presynaptic neuron. And it basically is just going to be used and repackaged so that it can be exocytosed into the synapse again. But the problem is that individuals who are suffering from depression, serotonin is something that actually relieves a lot of those symptoms. So if we are taking serotonin out of the synapse, we are reducing the activity of serotonin. So what we can do instead is block that transporter protein. And so that's what SSRIs do. So selective serotonin reuptake inhibitors go in, block that transporter protein, and inhibit the reuptake of serotonin. Now, I know when we think inhibit, we usually think antagonist. Remember, an agonist increases and an antagonist decreases. So when we think of inhibiting, we generally think of antagonism, but realistically, by inhibiting that transporter protein and by inhibiting reuptake, we're actually letting serotonin stay in the synapse for much longer. So it's technically, it's an agonist instead because it allows serotonin's activity for a much longer period of time. And then with SSRIs, it's the exact same way that SNRIs function. So all SNRI is a serotonin norepinephrine reuptake inhibitor. And so it functions in the exact same way. So for both serotonin and norepinephrine. Yeah, so that's how our antidepressant medications tend to work. There's a few other types of antidepressant medications that are outside of the reuptake inhibitors, but I don't think they're AP testable. Somebody also asks what's the difference between a compulsion and an obsession. Selena and Rakesh, did you guys want to take those or did you want me to?
I think it's okay if you take it.
Yeah, absolutely. Yeah, of course. So obsessions and compulsions are different in that one is a cognition and one is a behavior. So when we look at obsessions are thought processes. They are patterns of thought that are incredibly intrusive. And so that is the cognitive component of OCD. So an obsession could be something like fear of harm for yourself or for others, fear of, it's not always fear, but yeah, commonly things like harm to self or others. There's a lot of pathogen-related obsessions. There's a lot of obsessions for things like order or counting or symmetry. So the obsession is the cognitive component. And it becomes OCD when we pair that cognitive component with a behavior that temporarily satisfies that cognition. So for example, if we have intense, intrusive, unwanted, overwhelming, and chronic needs to wash our hands and clean everything around us, so like a clinically diagnosable case of obsessions that's like overwhelming, we can pair that with a behavior of hand washing. If we're so afraid of germs that we are compulsively hand washing, that temporarily actually reduces the intensity of the obsession. So it's a kind of temporary solution that's going to reduce the anxiety that comes from the obsession. Now, I'm going to throw this out to you guys and ask, what type of operant conditioning technique are we using if we are increasing the likelihood of a behavior, a compulsion, because when we do it, it reduces the anxiety from our obsessions? So I have like 100 and something messages over there. There's no way I'm going to get to it now, so I'm just going to keep going. But yeah, our obsessions are cognitions. Our compulsions are behaviors that temporarily satisfy those cognitions, and they do so through negative reinforcement because they reduce the anxiety and it makes that behavior more likely. So I hope that that makes sense. Any others? Any other questions that Sean can throw into the back channel chat or up on the screen? Cool. We can also do like a large Q&A at the end. So we've got I built a 75 question practice quiz for you guys. So I'm hoping that we'll still have time for all of for like a large Q&A. If we want to move forward now, we can probably make time for a longer Q&A at the end. Does that sound good for you guys? Perfect. All right. So if you have any more questions on this unit, just hold tight or throw them over into the Q&A tab. And we'll switch over to social. We'll get Sean down here. And yeah, we'll do some socialing.
Hey, everyone.
Welcome back, Sean.
Actually, Unit 9 is my favorite unit of AP Psychology, and social psych is my favorite topic in all of psychology.
Thrilled for you for that.
Yeah, I think it's super interesting to think about like how we work in relation to other people. I think so much of like psychology is like how we interact with people, why we interact with people. And I think that's perhaps like to me, it's the most interesting thing. I know, Jenna, you love your brain and your neuro and bio and all that stuff, but
honestly, it's one of my least favorite units from a research perspective, but I do like the phenomena just from like a human perspective. Like, I think it's really, really cool, but it's just not something I ever want to research.
Yeah, I mean, it's super interesting to learn why we act the way we do, although it is very hard to create experimental studies, especially like causal ones, when studying human behavior. But cool. So let's get right into Unit 9. Awesome. Let's first start with attributions. So attributions are ideas that we develop to explain different situations, behaviors, and characteristics. And there are two main types of attributions, which will become super important when we think about the fundamental attribution error. So we first have situational causes, and those are external events, opportunities, and environments play a factor in causing a behavior. For example, an example of a situational cause would be he did bad on the test because it was extremely difficult. That's attributing the difficulty to the exam rather than a lack of studying or a lack of preparation, whereas those would be dispositional causes. So a dispositional cause is more internal. It's, internal motives and personality characteristics cause our behaviors. So for example, he did well on the test because he studied a lot. He did bad on the test because he didn't study a lot. Does everyone want to take a second, maybe drop another example of either a situational or dispositional cause in the chat?
I'm never going to catch up in this chat tonight, I don't think. I'm 130 back right now.
It gets to a point where it's just beyond catching up. But some other examples of situational causes would be, oh my gosh, it's hard to come up with things off the top of our head. Oh, while you're driving, a situational cause, if someone cuts you off, might be they missed their turn and they're not doing it to be a bad person. They're just doing it so they can make the exit and save the turn because they were confused. This happened to me earlier today because let me tell you, driving to Boston is a nightmare. But the car behind me, let me tell you, I'm pretty sure by the way they hit their horn, they were attributing it much more to me as a person, thinking that I'm a bad person, I'm a jerk for cutting them off.
How dare you?
Right? And that would be an example of a more dispositional cause, because they're attributing this what happened to me as a person rather than the situation that I was in. So cool,
Love it.
awesome. I'm seeing great examples flowing in the chat, so definitely read all of those, and we can hop over to the next slide.
There's just a comment here from Zoe from 6 minutes ago that's now completely out of context for me that just says, OMG, can I take it, Jenna? And I'm like, what were we even talking about?
I actually think that was obsessions and compulsions.
Nice. I'm sorry, Zoe, I didn't see your question. I would have let you pop down and give the answer. I'm real sorry.
Cool. So now, when we think a little more about attributions, especially in the world of social psychology, we talk a lot about the biases of attributions. So for example, we have the self-serving bias, which means we attribute our successes to dispositions, so internal characteristics, but our failures to the situation, so external characteristics. For example, I did so good on the test because I put so much work into it, and I'm such a good student, and I study so much, and I study all the time, and that is why I got a good grade on the test. Whereas, on the opposite hand, if I didn't do too good on that psychology test, I don't know how hard your tests are, Jenna, but
They're not as hard as the AP Psych test. They're not.
Yeah. I think that too, actually. I think college exams are easier than the AP Psych exam.
Yeah, my tests are harder than the 5-able quizzes, but they're not as hard as the AP Psych test.
Yeah. So then, yeah, the other end of the self-serving bias would be, I did awful on the test because the professor is mean, they're a bad teacher, and their exam is too hard, which is what I think about the College Board sometimes. So, but yeah, that's a self-serving bias in action. When we talk about our successes in terms of our innate characteristics, who we are as people, and we talk about our failures as the situation, as a product of the environment that we were placed in. Which kind of segues well into the just world hypothesis, which is the idea that the world is fair and people get what they deserve. In more simplified terms, it's the idea that bad things happen to bad people and good things happen to good people. And the probably most well-known example of it is karma. If I do something good's going to come back and happen for me. If I do something bad, karma's going to get you. So that's one of the most common examples. And then the most common example of the just world hypothesis in everyday life is actually victim blaming, where victims...
Excellent example of this hypothesis.
Yeah, it's definitely one of the most applicable and present ones in the real world that we see, unfortunately. Awesome. And it's the idea that victims of sexual assault are often blamed for the attack. They're bad people, and that's why it happened. Which is horrible to think about, but unfortunately that is the just world hypothesis in more of a sad term. Although we also did talk about the just world hypothesis the other night for anyone who was with us during night 2. I think we used an example of like Sally throwing rocks at a seagull or something, and then Sally fainting.
I was like, yeah. Somebody goes, she faints because I think she was throwing rocks, and I was like, you know what? Let's roll with it.
I was like, I mean, it's right. So yeah, so there's a lot of applications for the just world hypothesis, but the ones we see most often are the idea of karma and unfortunately victim blaming.
Yeah, absolutely.
So a third bias of attribution is that we a lot of the time assume that others think and react like we do, and we tend to overestimate how much other people agree with us. Especially when trying to understand the way that someone behaves the way they do. We assume when someone's put in a specific position, they are reacting the same way that we would. So for example, if I am a big fan of one political candidate, I would think they must have a lot of support because I support the political candidate. So that likely the consensus among the masses is that they support this candidate as well. So that is the false consensus effect.
Look, I'm going to be honest with this false consensus. Now I can't speak today.
A hard word.
Effect. It's kind of for a little bit. I'm guilty of this one all the time. Things that I'm just like, I would have never done that. I'm like, what is wrong with you? And then you really got to talk yourself down and be like, well, just a reminder, Jenna, false consensus effect.
Exactly.
I can't think today. I am guilty of this one is what I was looking for.
Also, Another example of the false consensus effect, actually, that happens with teachers a lot, is they'll be like, this makes sense, right? That's another example of the false consensus effect. No response is usually treated as, yeah, we all understand. When we, yeah,
I look at my students and I have a lot of them, like 150 in my classroom this semester, and I will like try to make eye contact. And I'm like, look, you can't just not say anything. Like if you don't say anything, I have to assume it makes sense. So like I need one of you to just be like, no, it doesn't.
one more
make
time,
sense. And then I can elaborate and I can explain. But if you guys don't say anything, what am I supposed to do?
Exactly.
You guys are vocal in the chat though.
Oh, most definitely.
You guys are fine. We know. When you're not happy.
But yeah, does any of you guys in the chat have an example? Or you know what? I'm gonna move on to the next slide, but drop examples of when the false consensus effect might have happened in your life beyond the classroom, which I know I've had that before when a teacher's like, this makes sense, right? And I was like,
because you feel like it's just you. You're like just barely hanging on. I remember taking a class where I was like, I'm never gonna say anything in this classroom because I have no clue what's even happening here.
Exactly. And then all of these ideas about attribution lead to, I would actually consider this one of the key ideas of psychology, the field as a whole. Oh, did my camera freeze? Oh, I think I just had a connection loss moment. One of the key ideas of not just social psychology, but the field as a whole is the fundamental attribution error, which means we tend to attribute others' behaviors to their dispositions and ignore the contributing situational elements.
Yep.
In more simple terms, we tend to overemphasize personal characteristics and ignore situational factors, which becomes really, really dangerous when we get into the later slides about intergroup dynamics, when we tend to overestimate personal characteristics of the outgroup and ignore situational factors, which only increases polarization between people. But we will dive way more into those intergroup dynamics a little later. But super important to remember the fundamental attribution error. I can almost guarantee you will have at least 1 or 2 questions on it. This is one of the major ideas of social psychology and biggest ideas of psychology as a whole. So we tend to attribute others' behavior.
Highlight it, all the things.
Something I like to use, I call them star thoughts. I put a star next to it if it's like a star thought. One of my teachers used it one time to be like, this is a star thought. So that means put a star next to it, remember it, it's probably going to be on the test.
And that's what I do for the rest of my life now.
Yeah, I love it. So yeah, it's a great way to pay attention. So this is, if I can give you 1 star thought of social psychology, we tend to attribute others' behaviors to their dispositions and ignore the contributing situational elements, especially in negative actions of members of our outgroup. Cool.
Absolutely. Oh, here we go. All of those that you had in the chat, we were ahead of ourselves.
Yes. Let's see a few examples of this fundamental attribution error. I know I just keep going back to that person was really, really rude while I was driving today.
It's always like you always get bitter on the road, honestly. The road is like the worst place. Like I have never met a single person who's just like, oh, you're gonna honk at me? Okay.
Yeah, exactly. Especially in Boston. Boston drivers are a different breed, let me tell you.
Yeah. I was at a conference at MIT. I don't remember when it was, a couple years back, and it was wild.
Yeah, cool. Oh, I'm seeing some awesome examples flow in. Oh, homelessness. Yes, that is a famous example of the fundamental attribution error. She's late because she's slow, and I'm late because of the weather. A great example of the fundamental attribution error. And not only that, how we have different standards for ourselves versus others. Absolutely. Especially, again, when it comes to members of the outgroup. There is, let's see some other ones. If someone is ignoring me in school, I may blame them and think they are selfish, but it could be because of troubles they have at home with their parents, or maybe they recently had a loss in the family, but we tend to attribute it to them being rude and selfish.
Yeah.
Awesome. Yeah, these examples are absolutely amazing. Oh yeah, this person bumped into me because they're rude. Another great example, not because there was no space and we were both trying to get through a tiny thing and didn't see the other one. It's because they're rude. Also with like accidents sometimes on the road, when someone bumps into someone, you often think that person's a jerk. They paid no attention. They're like, have no clue what's going on. when in actuality they could have like just like spaced out for a second. They
Yeah.
could have not seen the light change. They could have gotten a call like that came through their like car speakers that distracted them for a second.
Look,
So
sometimes calls come in so loud, you can hear them.
exactly. Cool. So those are awesome. Yes, keep all this in mind. Put a star in. Oh, I'm gonna lose my hat. It's a bad hair day. I just care so much about the fundamental attribution error.
This is one of the times where I tend to soapbox to my students, where it's like it's one of those things where we can really truly understand our own behavior and other people's behavior, especially through this chapter. This chapter is one of the ones that gives a lot of insight into the things that we do. And so one of the great things about the fundamental attribution error is that if we remember it, we can possibly be a bit kinder in our cognitions and thoughts about other people. And the hope, obviously, is that they'd be doing the same towards us. But the fundamental attribution error, really just keeping in mind that there's a lot more going on in people's lives than we're aware of. And we tend to forget more easily. So
yeah. And thank you for making that point, because a huge part of learning, at the end of the day, whether you get a 1 or a 5 on the AP exam, it's not going to affect your life in the long run.
No.
I'm a year into college, and the AP, my AP scores have meant nothing. But what we learn in psychology, what we learn about human behavior and how we act and how others around us act, are lessons we can take into life, are ways that we can understand the world better. And that's why I talk so much about how I love research methods. It's so important that we understand how to do good science and be good scientists in the world. So this is definitely one of those examples. So I really appreciate you making that point, Jenna.
Look at that. Just take AP Psych and be a better human.
Exactly.
I love it. All right. Do we have some examples that we've got on these slides?
I think I do have a couple on here actually animated in. My employees are late to work because they were lazy, and I was late because of traffic. I like that.
Okay, what's next?
My friend didn't answer the phone when I called. They must hate me. They're so rude.
I feel like that one is like tagged with a little bit of anxiety as well. So, you know, a little cross-reference on units.
Exactly. And then this person cut me off. Oh, I wrote this like 3 weeks ago, and look, it happened today. This person cut me off.
You manifested.
Oh my gosh.
That's why it's important to manifest your 5s, friends.
Exactly. Manifesting works. No, don't write that on any of your FRQs. But for our purposes, manifesting works. Star thought.
I love it.
Yeah, this person cut me off at the intersection because they are a jerk. They must be an awful person. And then, yeah, Akshay, that was a great point you made in the chat. A lot of time, the fundamental attribution error is why things like racism and sexism and homophobia exist in our world. And again, that all comes into the in-group versus out-group ideas.
Yeah,
cool.
Which we will for sure be talking about soon, too.
Awesome. Now, this is my one of my favorite parts of social psychology. I love it all. But we are going to talk about, attitudes. Just kidding. Not one of my favorite parts of social psychology.
I do this all the time. I think I get into the right spot, and I will lead my class to the thought that I think is coming, or to the slide that I think is coming.
Yeah, I was ready to talk about Milgram.
And I'm like, I'm so ahead of myself right now. And then you gotta walk it back, and you're like, okay, let's try this again.
I'm too excited to get there. Cool, but so let's talk about attitudes then. Attitudes. Actually, Jenna, do you want to take the attitude section?
Sure, absolutely. So attitudes are just another form of cognition that's directed at what we call an attitudinal object. It really could be anything. It can be a person, it can be a place, it can be a thing, it can be a situation, it can be, there's lots of different things that we can form attitudes by. So I'll throw this out to the chat. When we think about the word attitude, just in general, not even in AP Psych terms, but when we think about attitude, like what usually comes to mind? Tell me what comes to mind usually when we think about attitude. And as you're doing that, generally what we think about is like, so parents who are like, oh, my kid has such an attitude. It's such a bad attitude. Or, we think about people being like snotty or rude or something along those lines. And when we talk about attitude in terms of AP psychology, or psychology in general, this is just something that we think. That's it. It's a thought that becomes kind of like it will lead to feelings. It's not a feeling in and of itself, but it is going to like create different feelings and promote different responses. So we form our attitudes through just our general experience. So we can form attitudes through like the way that we're raised. We can form attitudes. So I'll say, I guess I'll throw out, does anybody like really, really love something that their parents really, really love? Or do your parents really love something so you went the complete opposite way and you really, really hate it? That's an attitude. So like there's this band that my dad loved growing up and I hated them. And then it took me until I was like almost an adult to be like, they're actually pretty good. Like this. That's your attitude, right? And when we are developing attitudes, this is going to be through predominantly observational learning as well as classical conditioning. So we classically condition that attitudinal response or the emotional response that's going to cause it through, again, classical conditioning. Now, one really cool thing about attitudes is that we can actually strengthen them or weaken them. And certain people can have stronger attitudes than others. So there's this thing called need for cognition. Need for cognition is just our general like predisposition to want to obtain new knowledge. So when we have a high need for cognition, we really enjoy seeking out information and thinking very critically about it. People who seek out information and think critically about information, and those who are high in need for cognition, those people actually have a lot more strong and stable attitudes as compared to people who don't have a lot of information or even a lot of effort that's gone into developing their attitude. So when we put a lot more time and thought into our attitudinal objects, they tend to be much stronger than when we don't. So again, called need for cognition. Our attitudes indeed inform a lot of our behaviors. Now, I don't know if I'm going to lead us into the slide properly here, this next slide. Usually this is how my slides go, so I don't know what's next. But typically what I talk about next is like emotional responses and the ways in which we behave around our attitudinal objects. So I'll just throw it out here just in case. But our attitudes actually inform our behavior. So we behave in accordance to our attitudes. And when we don't, this is going to lead to things like cognitive dissonance, which we will for sure talk about. So cognitive dissonance occurs when our attitudes are not aligned with our behavior. So yeah, we'll get to that for sure.
This is a perfect time to mention I am a ride or die Celtics fan, and because of it, I hate people from New York.
Okay.
No,
That's like sports. I'm excited for your sports fanning. Oh no, Sean.
Perfect shameless plug for Go Celtics in the playoffs. Any other Celtics fans here? My parents love the Celtics, so I love the Celtics. And then as I've continued to go seek out more information about them, learn all the players, learn all of the information, my need for cognition grew, and I have stronger and more stable attitudes about how much I love the Celtics. There's actually, fun fact, a stock photo of me at a Celtics game.
Humble brag.
Humble brag, yeah.
I think that's the same as, so I grew up in California and I didn't move to Michigan until like 7 years ago or so. I had no clue that Michiganders and Ohioans hate each other, but let me tell you, I hate Ohio. Now, you know, you just get into that mindset and it's an attitude, that's for sure.
I'm just kidding. I love people from New York. I love all of you New York fans turning in. Sorry, you just picked the wrong team to cheer for.
All right, are we ready?
Yeah, I'm ready to move on. Okay, now into my favorite aspect of social psychology to talk about is the 4 major social studies. So yeah, these are 4 things that have revealed a lot about about human behavior and how we might end up behaving if we're placed into one of these similar scenarios, despite thinking that we could never be affected by any of these phenomena. So let's get right into it. I believe we start with compliance. Yes.
We do. With your fancy animations.
I love my animations. And yes, I just want to make a quick little plug before we go into this. Please, please, please make sure we treat all these topics with respect. I know We usually talk about this a lot in clinical psychology, but I also think it's very applicable to social psychology too. It's easy to say that the people in these who are participants and subjects in these highly unethical experiences are bad people or acted poorly. There's a lot that of things that we can say, but it is important that we treat this topic with the utmost respect, similarly to the way that we would treat clinical psychology.
Yeah, absolutely.
My camera's like going crazy today.
Is it your camera or is it Crowdcast? Because Crowdcast is grumpy.
It's probably Crowdcast, to be fully
We'll just
honest.
blame
It
on
usually
Crowdcast.
is.
And you know what? See, that's something that's formed by an attitude. We
Mhm.
have experience from Crowdcast that was negative. So we have an opinion and an attitude about Crowdcast now. And now anything that bad happened or that happens that's bad, it's Crowdcast's fault.
Exactly.
So look at that attitude formation and that thing right there.
A beautiful example of social psychology in the real world. Awesome. Cool, let's get into it. So compliance is the change in behavior at the request or direction of another. And the two ideas that I like to talk, so for the next three, we'll talk about specific experiments, but for compliance, there are two very specific, very practical examples that I like to talk about. The first is the foot in the door technique. And that idea is you make a small request in the hopes of at one point convincing someone to later agree with a larger request. And kind of like Jenna was talking about earlier, she was right. We lead right into it from attitudes. It's connected to cognitive dissonance. We try to act in ways that reduce cognitive dissonance, that allow us to have the most consistency in our lives so that we can, cognitive dissonance exists in many ways. It's so we can look back at our past selves and have consistency in our beliefs, but also it informs how we act in the future so we can be consistent with our current beliefs. So this is where the foot in the door technique comes in. I could be like, hey mom, can I borrow $5 to get a video game? That's my foot in the door. That's my small request. And then maybe then I follow with the big request. Hey, can I actually also buy $300 to buy the new video game console? Or $500 if we're talking to PS5 now, maybe even more.
It's going to work.
Exactly. And then the other end of that is the door in the face technique. And I don't have statistics on if one's more successful than the other, but I personally think in my life the door in the face technique works better, and it's used in a lot of ways, especially when it comes to political campaigns. But
Okay,
it's the idea of
you for just a second. I'm going through comments, but I think they might be old. Can you guys tell me, is Sean still frozen? Is anybody from our team, is Sean frozen?
how many
old
fingers am I holding up?
there was a lot of them that said that you were frozen, so I just wanted to
Oh,
double
no.
check. Can anybody on our team check the chat, because I'm not going to be able to get down there in time and see if Sean is still frozen?
No, the majority of people are saying that he's not frozen anymore.
Perfect. Okay.
Perfect. Good to hear. Awesome. Cool. So then the door in the face technique is flipped. It's when you make a large request in hopes of convincing someone to later agree with a smaller request, which again goes with cognitive dissonance. So for example, I might ask someone, would you mind volunteering for my political campaign? They say no. I could hit them with, well, do you mind at least putting up a yard sign? And actually, I talked about an example of this. And this actually might be, I think we talked about an example of foot in the door in my psychology class that I thought was really interesting, where about cognitive dissonance. So now I'm going to jump ship to cognitive dissonance a little bit just to make sure we really understand that. Where they were collecting signatures to get a political candidate on the ballot. And it's usually easy. If someone usually comes to your door and asks for a signature, what does it hurt to sign the paper? So a lot of people tend to give signatures.
Sure.
And then they'll come back a couple weeks later and come back to the door and be like, hey, thank you so much for endorsing me and signing my petition. Would you mind putting up a yard sign out as well? And then they do that. Because you want your beliefs to be in line with what your past self believed. So you're more likely to put that yard sign in. But then to the other end, the door in the face technique, you might be like, can you put up this giant banner that spans your entire front yard? To which they might say, no, absolutely not. But then if you ask, hey, will you endorse me for my candidacy? They might be a little more likely to.
I
So
love it.
yeah, that's compliance, all about compliance.
It's a really great way if you wanted to use this compliance technique on your friends and family. Use Psych,
Yeah.
Psych on your friends and family. And this is one of those ones that will do it.
Again, it's those lessons we take away from psychology that are the most important. Get that video game, guys. Get those video game consoles.
I love it. All right, moving on.
Awesome. So our next major social study is conformity, which
I
is
love these little animations. These are so cute.
Animations really make a slide deck. That's all I gotta say. So conformity was investigated by Ash. So if we hop on over to the next slide, I believe I have a picture. Yeah.
The line study. I saw Tessa say it.
Yes, the line study.
Did you guys go and watch the video for this? I told you guys last time to watch the video. It's so funny.
Yeah. I actually highly, highly recommend watching the video for all of these. The conformity one is funny, but the other two, they're not funny by any means, but it's really just interesting to like watch the decision-making process. But I'll get more into that a little bit later as well. But yeah, conformity is the tendency to modify behaviors, attitudes, and opinions to match the others around us, which, as Jenna was saying, when Solomon Ash did this line study, which you can see to the right hand of the slide, we have the reference line in A, B, and C. So I guess the way this study worked was that there is a room full of Confederates. A Confederate is a fake participant. That's important to know for your research methods question.
Yeah, repeat that though, because I don't know if people heard you.
Yes, a Confederate is kind of like a fake participant. A Confederate is someone who's in the room and acting like a participant, but is actually planted there by the experimenter. So what they did is Solomon Ash had them all set at a table, and he showed them this reference line, and then lines A, B, and C, and he asked which one of these lines is the same length as the reference line. A pretty easy question, but all the Confederates in the room answered A instead of B, which clearly it's B. If you guys tell me in the chat what line is the same as the reference.
It's C, obviously.
Is it C?
So I see this question that's in the chat. I think, let me just make sure I'm on the right spot. It's Andy's question. Now, is it unethical because you're purposely deceiving participants? Now, that's a really great question. Deception isn't something that automatically is going to disqualify a study. So you can use deception, but you can only use deception if you cannot study the relationship or the variables without it. So if there's a way to be able to study that hypothesis using something other than deception, you are required to do so. They will not just allow you to use deception. But if what you say is, I have to study these group dynamics, I cannot tell my participant that they're in a group of fake participants, then that's deception. Now, when it comes to deception, there's two forms, and I believe this is present on your AP exam. There's active deception and there's passive deception. You guys can correct me in the back chat if I'm wrong, or Sean if you know. But one is active lying and the other is just not providing the full information. So active deception is a lot more controlled, and it requires a lot more approvals from the IRB. Whereas passive deception is kind of let slide a lot more often because you're not actively lying to your participants, you're just kind of withholding information. Now, keep in mind that any study that uses deception is going to require 100% debriefing. Debriefing is essential when we use deception because you need to make sure that your participants know exactly what was going on when the study concludes. So,
and also,
go ahead.
Oh, sorry. And also a big giant asterisk next to the deception idea is that as psychologists, we can never do more harm than good to our participants. So if the deception involves harming people, either in mentally, which a lot of the following studies did do, then it would still not be IRB approved. IRB is, I don't know what it stands for, but it's basically the ethics board.
It's the Institutional Review Board.
There we go.
I know there's going to be a quiz question on it tonight, so put that in your notes. The Institutional Review Board is the ethics board for any federally funded institution that runs research. So they're at all universities, all government organizations like the NIH and things like that, all require an IRB.
Awesome. Yeah. So I guess hopping back over to our conformity study, all the Confederates in the room answered A as the correct answer. And then you get to the participant who's looking around like, am I going mad? Am I going crazy? And that's the funny video Jen is talking about that I highly recommend checking out. But at the end of the day, he still said A as the answer, even though he knew the answer was B. And in fact, 76% of the other participants in this experiment also gave the incorrect answer at least once.
Yeah.
So why is this important? What does this teach us? Well, it teaches us that people abide by social norms and often conform to them in a social environment. So we're likely to conform to what others do. And that's why so many of the participants said A was the correct answer.
Now, sometimes it's really difficult to differentiate conformity from obedience because both of them involve changing your behavior at kind of like the influence of another. So we're going to get into obedience very shortly, but I want to make clear that conformity is the change in our own behavior to align with the larger group. Obedience is not the change in our behavior to align with a group, only conformity. So we are changing our behavior to align with the social group that we're in.
Awesome. Yes. And then I will make sure after we talk about obedience too, to compare and contrast those two as well.
Perfect.
Awesome. So let's get to our next social study. I believe is actually obedient. Maybe? Let's see. Oh, it is obedience. There we go.
Look at that.
It's almost like I made them. Yeah, so obedience, the VIP is Stanley Milgram. I assume many of you guys have heard of the Milgram obedience study. Yeah, this one is huge. One of the most unethical studies that we often cite. It's a key example of a study that taught us a lot about human behavior, taught us a lot about how we interact with the world, taught us a lot about how people interact with authority figures, but at what cost is the question we look at now. So obedience is the idea of people comply with authority. What the Milgram obedience study examined was how far would people go if the authority figure tells you the experiment requires that you continue. And for anyone who's seen a video of it, which I, again, with these studies, highly recommend looking at a video of what actually happened because it's perhaps the best way to understand it. One participant was placed at a board where there was a bunch of different voltages that they could shock the Confederate with. On the other side of the wall was a Confederate who would answer questions that were posed and would receive a shock. So the participants think they're shocking the Confederate. The Confederate isn't actually getting shocked, although they did act like they were. So they would ask a question, the Confederate would get it wrong, and the person, the researcher, so the person in the lab coat, this is often referred to as the lab coat effect. The person in the lab coat would say, okay, nope, shock them with 5 volts. And this will continue. It will continue to a point where the Confederate, who again was not being shocked, was screaming. They were like, oh my God, I need to stop. Let me out of here. Let me out of here.
You sound just like the video. I think that's like word for word. That's just like it.
Yeah, they were screaming. And the participants kept looking back to the researcher, or the person who was playing the researcher in the lab coat, and saying, we need to stop. I need to stop. Like, I can't keep doing this. And all that the researcher would reply with was the experiment requires that you continue. They didn't force them to. There was nothing that was like, if you leave this room right now, you're going to jail. There was nothing stopping them from standing up and walking out of the room. All the participants. Did
you just say the 1900s studies? The 1900s? What is this?
Yeah, the 1900s.
Get out of here.
Wow. A lot of the early 1900s, especially.
Do you guys say like the 1900s? Is that legit a thing? I've seen it online, but I just didn't think you guys really would say like the 1900s.
I honestly, I usually feel like people say like the 90s and the 80s, but no, I guess it's the 1900s now.
I mean, it's past. We're in 2023 already, so.
Crazy.
Oh my God.
Crazy to think about that. But yeah, I guess kind of back to this obedience idea. It's shocking. So before the research was conducted, psychiatrists and students and professors of all kinds were surveyed as to how far they think participants would go. So, also it's worth noting that on the shock machine, some were labeled "do not shock," "deadly," like stuff like that. So
X's, like triple X, like do not, yeah.
So the participants knew what the shock could do. And psychiatrists predicted that about 4% would go beyond the 300 voltage, and students predicted that about 1%, less than 1%, would reach the highest voltage. But when the experiment actually was carried out, 65% of participants administered shocks up to 450 volts, even when the learner is the confederate, even when the learner stopped responding and went silent.
Yeah.
All because the experimenter said the experiment requires that you continue. Now, I think I saw in the chat a little bit earlier, someone was talking about how this experiment was unethical because debriefing wasn't provided. And that's not necessarily the case. Participants were debriefed following the study. Actually some of the interviews with the participants after the study are they're just crazy to watch. How people like explained why they did it. And honestly, it's so hard to think that we could ever be in a situation where we'd do the same. But the participants going into the experiment never thought that they would be in that position either. They never thought that they would go to the highest voltage. Yet the lab coat effect, the obedience to authority, it did that to people. It pushed them to 65% of participants to go to a deadly level to keep going when the learner who they thought was actually a learner stopped responding. So this taught us that people have a tendency to obey authority figures. No matter what they're doing, no matter what the implications of their action are, people have a tendency to obey authority figures, which is called the lab coat effect. And this will bring back to Jenna's point that she made earlier. The difference between this and compliance, between this and compliance is that compliance is
Conformity.
Oh, sorry, conformity. Yes, conformity. You're right. Getting the words all mixed up, all the C words.
Okay.
Conformity is when you conform to a group of other people at your level, a social circle. You conform to their consensus, their belief, what they're saying. Whereas obedience is specifically conforming to an authority figure. It's complying to what an authority figure has to say, their orders, their thoughts, their words. So that's the key difference between the two of those.
Absolutely. So I see a lot of comments in the chat about, and I think I didn't read it in full, but Josie had made a comment here about the study being inspired by the Nazi regime, and that's 100% accurate. So this was really inspired by the Nuremberg trials, where people who were on trial from World War II and who were Nazi soldiers or Nazi doctors, for example, were claiming that as part of their defense, that they were just under orders to do so, and it wasn't their choice, and they had no control over it. And Milgram and the vast majority of Americans had said at that time, there's no way that Americans would behave in the same way. And that's actually what inspired the Milgram study. Milgram had said, Americans our country is founded in these principles of freedom, and everybody kind of has this personal freedom alignment, and there's no way that with our moral foundation that again, these are Milgram's words, that Americans would do the same thing. And so that's where we get those numbers of psychiatrists thinking that about 4% of people would go all the way with shocking, and those were called pathological sadists. They assumed that it was pathological sadists that would do that. But like Sean pointed out, about 65 of participants went all the way to the highest voltage, despite that guy protesting, even saying that he had heart issues and he couldn't be shocked. And it's really, really crazy.
And yeah, something one of my professors said that really just sat with me is that could have been any of us in that room told to go on to the next shock. And as much as I would like to think I wouldn't, as much as I think all of us would like to think we wouldn't, in theory, according with Milgram's results, 65% of us would. And it's just, really crazy to think about. And this is another reason why we like to say to treat this topic with sensitivity, because it's a deep thing to think that people could be not even convinced, people could just obey orders to go that far. And it's scary to think what that means in the world, which, as we saw with the Holocaust. But all right, we can.
This is important.
Yeah, so we will hop on to the next subject now. I know obedience is fascinating, but so are groups, which is what was studied by Zimbardo. I would imagine many of you guys have heard of the Stanford Prison Experiment. So that was Zimbardo's study about group dynamics.
Let's go.
So the Stanford Prison Experiment occurred in 1968 and attacked the central question, how do roles, labels, and social expectations play out in a simulated prison environment? And what they did to do this was they got a group of, I'm actually not sure how many college students, probably like 20.
It was about 20.
Yeah, about 20 college students, and randomly assigned them to the role as either a prisoner or a prison guard. And then where they were all thrown into a mock prison. They had the ability to leave at any point if they needed to, if they chose
They were
to.
told so.
What was that?
They were at least told so that they
Yes,
had the
yes, sorry. Yeah, having the ability and being told something are two very different things. Yes, it's an important distinction to make. So they were told that they could leave the experiment at any time. But what we found is that guards and prisoners really conform to their roles in this experiment. And although the first day or two, actually not even two, the first day, there was no crazy group dynamics present. People weren't acting and treating each other horribly. But after just a few hours, some extremely cruel and dehumanizing behaviors were observed. The prison guards were treating the prisoners in absolutely horrible, unimaginable ways. And this is for an experiment. They know that they're partaking in an experiment. They know that these other college students are just their college counterparts, people that they could sit in class with. Yet, after 6 days, the absolute cruel and dehumanizing actions that Zimbardo observed led him to terminating the experiment, even though it was scheduled to last 1 to 2 weeks. So we learn a lot about group dynamics from this study. We first learned that individuals readily conform to the social roles they are expected to play, which was especially true for the prison guards, who were eager to take on that role, and then ended up treating the prisoners absolutely horribly. And then I think the second, perhaps more hard-hitting lesson that we learned from this is that everyday people, under the right context, have the potential to harm others, which is, again, another idea we talked about in Milgram. Like, would we go that far? I like to think I wouldn't, but I don't know. I was never put in that position. I like to think that under the right context, I would never adopt a group alignment, a group affinity, a group identification that would push me to treat other people so horribly. But do we know that for sure? No.
That's the biggest thing about, group dynamics and especially psychology is we see all these studies that say this percentage of individuals are, behaving this way, and this is what we found through these studies. And we all want to sit here and say, there's no way we could do that. There's no way I could do something like that. But what we find is that realistically, everybody who was in those studies said those exact same things as well. So
Yeah.
It's important to know these phenomena exist because the knowledge of them is what prevents it from happening again in the future.
Exactly. And that's why these lessons, although the experiments at the time were extremely unethical, the lessons we learned from them are important ones to understand. And some specific examples of when group dynamics got to the most extreme horrid level was Benghazi, which actually, when I was learning this in my introduction to psychology class in college, I recall our professor actually putting up a picture at Benghazi, and this picture will live in my head, especially just my professor. He was a social psychologist, so you can imagine his social psychology lectures were fascinating, absolutely fascinating. We actually had three whole lectures on it, but one part that really stuck with me was he put up a picture from Benghazi, which was an American soldier like posing with like a gun in the air and like a smile and like a thumbs up with a bunch of naked prisoners that were starving. And
so that's probably
you could tell it was
that one's and that's absolutely accurate, and that is one of those things that had popped up surrounding this idea, especially seeing that in like real life action.
Yeah, so that is one thing that will always stick with me from the social psychology unit. And I just want to take a second to remind everyone who's watching right now, who's in the chat, to please treat these topics with respect. It is super important that when we're learning about these intergroup dynamics, we take them as people who have been informed from years and years of psychological research, and we understand that what these experiments were not ethical at the time. And it's really important that we understand our role as psychologists now, psychologists of the future, and just humans of the future, is to take these experiments, understand what they mean, understand how they exist in the real world, and treat those topics with respect, and understand how we can work one day to ensure it doesn't happen again in real life. So I just want to encourage everyone in the chat to please treat these topics with respect.
There's
and
a lot
not,
of really good conversation I can see going on in the chat, and then there's also a lot of not helpful additions. So I absolutely encourage like the discourse surrounding the ideas that we're talking about, but we want to make sure we're doing it intentionally. And so I absolutely appreciate everybody's engagement with these subjects, but we really just need to make sure that we're keeping on focus with regards to the subject, and that doesn't mean that we can't talk about how this relates to our own experiences, how this relates to the experiences of our family members and the people that we care about, and just the experiences of the world. That's relevant. That's 100% relevant. We just need to make sure that the way we're talking about them right now in this space is going to be related back to these social psychology kind of factors that we're talking about.
Yes, thank you so much for that, Jenna. And thank you everyone in the chat for listening and acting appropriately in the chat. I guess the key takeaway from groups that Zimbardo taught us was that everyone has the potential for good or harmful behavior, but it is greatly influenced by the environments we are placed in. But yeah, so that is the main takeaway from that, and that concludes I think we have more about social psychology, but that those four conclude what I find to be four of the most interesting and important ideas of psychology as a whole. So now on to group processes. There's been a lot more research done on intergroup dynamics since Zimbardo's Stanford prison experiment, which have taught us a couple other important vocab words so that you guys are going to want to remember to nail those context FRQs, to nail those MCQs. And the first is social facilitation. And the idea of social facilitation is that the presence of others enhances performance. For example, we often point to sports games. So soccer games, basketball games, football games, Celtics games. And what we say is like at a basketball game, the fans cheering tend to enhance the team's performance, which is what we call home court advantage. So in playoffs, for people who are sports fans, there's usually like 3, 5, 7 games, and the team who is ranked higher gets to play more games in their home arena because the presence of the crowd tends to enhance their performance, which is where we get home court advantage from. The next idea is one a lot of you guys might have experienced in high school, actually, especially as AP students, is social loafing. Which is
I love that. I love that word. First off, loafing.
For real.
It's so descriptive of the phenomena, and I just think it's perfectly termed.
Yeah. Oh, and actually, sorry, before I get into that real quick, the same idea is also on the flip side of social facilitation. We don't have it on the slide, but social inhibition, which is the idea that a crowd decreases performance, which is often cited in public speaking examples. It's really hard to like present in front of a large group of people. So that is an example of the flip side, social inhibition. But
yeah,
yes.
So an example of social facilitation, one of my TA this semester had asked me, are you just really extroverted? And I was like, oh, absolutely not. I am not extroverted. I just have a lot of social facilitation when it comes to teaching. Otherwise, I'm not. This is.
So Jen apparently has the reverse of the typical with social inhibition. The crowd helps. I find that too. Like when I like teaching for larger audiences, I think having people there helps.
More engagement.
Yeah, cool. So next up we have social loafing, which means the presence of others within a group encourages people to work less hard than when working alone. They tend to push responsibility on the others and take the backseat and just chillax. The social loafing part. So the example that we have up there is, I have 2 partners for this project. They can take care of creating the presentation. They got it. They have it handled, and they are all set. Whereas if it was an individual project, we would take that on ourselves because we are the only person to do so.
Too bad we can't take the AP test as a group.
You know, that's what I was just thinking. Too bad we can't have the little AP Psych cram team up there
Yeah.
answering your questions on the exam as well.
Yep.
Cool. Then the diffusion of responsibility is the tendency to not take responsibility for action or inaction when others are present. When others are present. So, for example, I saw one of my classmates getting bullied, but it's not my place to say anything to my teacher. That's others are present. Someone else can say it. This actually kind of reminds me, Jenna, correct me if I'm wrong, but of the bystander effect.
It's actually what I was just thinking about. So diffusion of responsibility is the component that causes the bystander effect. So I don't know. Have we talked? Oh, it's next on the slide. It's at the end of the slide. Yeah.
Oh, what is? I didn't even see that.
Yeah. So yeah, the bystander effect is caused by diffusion of responsibility. And the craziest thing about diffusion of responsibility is that it's actually directly proportional to the number of people that are surrounding us.
Interesting.
Yeah, so there's studies that show, asking bystanders their likelihood to help. And people who are in groups that are larger are less likely to help. And it's directly proportional to the number of people. So, which is crazy.
That is really interesting. I actually did not know that. So that is super cool. So yeah, I guess from there we'll skip over to the individuation for a second and go right to the bystander effect. Individuals are less likely to offer help to a victim when in a situation when others are present. And the paradigm example of that is, I see an accident on the highway, but I just drive by because someone else will call 911. But there are a lot more like heavy hitting examples of this. Like, for example, I don't know if anyone's heard of the case of Kitty Genovese. Yeah, Genovese. She actually has there's a really interesting book called like My Tarantella, I think, that talks a lot about it. And so her example, or the example that happened there, was that Kitty was murdered in a New York area that was there was apartments flooding both sides. There were tons of people who were able to see it, yet no one called 911. They watched the brutal attack and murder, and nobody called 911 because they assumed somebody else would do it. The apartment next to me will do it. The person walking on the street will do it. Somebody else will do it. And that's they diffused responsibility to others, and thus the bystander effect manifested.
Yeah, so one just side note to note about the Kitty Genovese case is that there's actually been a lot of data recently, maybe within the past 10 or so years, that found that in fact her neighbors did call the police. So not to say that this is not why the bystander effect exists and the bystander effect is wrong. That's not the case at all. But the Kitty Genovese case itself, which was kind of like the proponent or the propellant, I should say, of knowledge about the bystander effect, was possibly more related to the fact that the neighborhood was relatively poor. And there was something about her personally that kind of made her they socially ostracized her. And so that might have contributed to their unlikelihood to call. So that's just something to keep in mind with regards to that case particularly. And I think it's probably going to come. I know with next year, they're actually revamping the AP program for Psych completely. And that is going to be probably one of the revamps, I would imagine.
That's really interesting to think about. And I guess that's very broadly applicable. It's important to think of what other factors, even though they sparked research and we found an effect as a result of them, are really just an example of how our society functions. And actually, I'm a little unrelated to social psychology, but one of the professors that I had just finished a research study that found that the areas that have welfare laws that help bring people out of poverty, the hippocampus in children is actually larger than the hippocampus of children in poverty-stricken areas without welfare laws requiring basic needs be met. So that's just another example of how the society might sparks research and how the environment we're placed in can affect how things show up.
Can we talk about that later? Because I want to know more about that, but I don't want to take up the time here.
Yes, for sure. Yeah, it was super interesting.
Okay, cool.
Cool. And so then, yeah, I guess another example of bystander effect we talked about the other day with, I think, Rakesh, Janine, we were talking about
Yes.
on the beach, how no one called the police to help her, not only because she was a bad person for throwing rocks at the seagulls, but also because they diffused responsibility to the others around there and assumed somebody else would call 911. And then our last idea is de-individuation, which is the loss of personal identity and lack of responsibility in large groups. So, for example, the way a person acts in a riot is probably not the same way that they would act if they were acting alone, which is the idea of mob mentality. And a very interesting example of this was the January 6th Capitol riots, which is a very timely example of de-individuation, how most people who were in that mob, in that riot, would not have on their own attempted to launch a coup against the United States government, but instead have probably just protested with signs. But de-individuation in those large group settings, the development of mob mentality led to the January 6th Capitol riot.
That's 100% a very timely example. This also happens after a lot of sports games too, especially Winter Games, World Series. This is when there's like people go to the streets and start flipping cars, setting couches on fire, and things like that. Same exact idea.
Yeah. Cool. So let's jump over. I think we have one more slide on social psychology. Oh, just kidding.
Because then we can get to our quiz.
Yes. Oh, I'm so excited for the quiz. Okay, so we have group decision making. I'll try to go through this one a little quicker. Groupthink is the tendency for group members to maintain cohesiveness and agreement and viewpoints, and fail to consider other viewpoints as a result for trying to find harmony within their group. So, for example, me and my friend group are planning a summer trip, and everyone seems to want to go to Italy, but I don't really want to go to Italy. I want to go to Spain. However, I'm going to go along with it because it will preserve harmony in the group. And a much more applicable example of this is the development of echo chambers, which are super important to think about and very timely in today's political world. People tend to gravitate towards groups who think like them, and then once they're in those groups, they typically fail to consider alternative viewpoints to the mainstream ideas of the group, thus buy in more to the group, and thus further become polarized in their beliefs. So that's how echo chambers form. I don't know if Jenna, I remember you were saying that. Yeah, I know this is a trickier idea, so I'll see if let Jenna explain it a little more.
No, it is definitely a trickier, I think. So Rakesh mentioned this in the chat just now, but groupthink and group polarization are often confused. So one of the things to think about when it comes with groupthink is that there is a large group that holds an opinion, and groupthink occurs when the people who don't match that opinion don't want to speak up. And at times there is a kind of like consistency formed in their opinions. So there's a lot of examples from, there was a space shuttle that had some like problems with it and some damage with it. And like the night before launch, they had even said, you know, we really shouldn't be launching tomorrow because of XYZ reasons. But there was some groupthink that had occurred in that case, and then that shuttle actually had disintegrated upon right after launch. And so groupthink in that circumstance was because there was a few members of that group that said, no, we're not going to stop. And it kind of overwhelmed the rest of them. Now, with group polarization, what we're looking for. So Brissa just said groupthink can lead to people who disagree to be ostracized. Yes, absolutely. So there's kind of like this fear of going against the group happening with groupthink. Now, group polarization's a little opposite in a sense, where group polarization happens when you enter a group with your own opinions and your opinions shift to the the most most intense pole of that group. So say you have like relatively mild political opinions, and then you enter a group with people that have like more strong political opinions. Group polarization means you're probably going to come out of that group with more strong political opinions. So it's just our tendency to intensify our opinions to the poles of who is around us in a group.
Yeah.
Polarization. Yeah, absolutely. Same phenomenon.
Perfect. I could not have explained that better. I'm so grateful that we have a Psych 1 teacher or a Psych 101 teacher here to help with the trickier ideas. But yeah, so yeah, groupthink and group polarization are two very important ideas in social psych.
Yeah. All right. So
our last.
Have one more.
Yes, this is our last slide. And this is another area that I find super interesting, which is us versus them psychology. It's when does the me versus you become us versus them? That's one of the main questions of this idea. And it's how groups act in relation to one another in group settings. So not me versus me as an individual versus you as an individual, but us as a group of individuals with common characteristics who align with the same beliefs, other factors that give us one group affiliation versus them, the people who have other ideas, other beliefs, and affiliate with other groups. So that's the idea of us versus them, like more broad overreaching. And there's 5 specific phenomena that I kind of just want to point out to you, words that might show up on the AP exam. Social categorization is the relatively automatic process by which we perceive people as members of groups. So group categorization can emerge from arbitrary variables, and we tend to look at people in terms of the groups that they align with. Jen, do you have anything you want to add to that?
I was trying to answer a question in the chat. Can you, this is the second time this has happened to me today. Can you tell me what you were talking about?
Yeah, just that we tend to perceive people as, when we see someone, we tend to perceive them as a member of a group first. We tend to see people as members of groups.
Yeah, are you under social categorization?
Yes.
Yeah, okay, perfect. Yeah, so that's actually perfectly accurate. So humans have a tendency to categorize. It's something that we do cognitively, and it's instinctual. There's components of it that are very natural for us to categorize. Now, when it comes to things like us versus them psychology, this is often going to occur when our group categorizations are inaccurate, unjust, fair, and discriminatory in many, many cases. So social categorization, again, is just, it can form on anything. We categorize people by hair color. We categorize people by t-shirt color. We form groups with people who are fans of our same sports teams. So that's pretty straightforward with categorization. And then did you want to talk about in-group and out-group bias or anything else on this slide?
Sure.
Tell me what you want me to take and then what you want to take.
I'm sure, yeah, I'll do in-group, out-group, and then you can take stereotype and prejudice, if that's cool. Awesome, cool. So I'll try to fly through this to make sure we have time for Jenna's awesomely amazing quiz that we have coming up.
It's 75 questions.
So we're going to fly through the 75 questions. But in-group bias is the idea that we prefer to be around people like ourselves. So when we, use a social categorization to perceive people, the way that we perceive people as members of groups, we tend to surround ourselves with people who are similar to ourselves. And we tend to perceive members of the in-group, people who are like us, as more charitable and more morally correct in comparison to members of the out-group, which then segues very nicely into out-group bias, where we tend to perceive people of the out-group as all the same and morally backwards. And then this starts to bring back that huge bolded slide that had one word to itself, the fundamental attribution error. Especially with members of the in-group, we tend to use we tend to attribute positive things to our personal characteristics. We're charitable people, we're good people, we're unique people, we're interesting people. And then members of the out-group, we tend to have that flop. So we tend to attribute negative things to them as people. They're morally backwards. They're wrong in this domain. They're bad people. They're jerks. So those are in-group versus out-group bias.
Yeah, awesome. So yeah, with our in-group biases, we perceive people in our group favorably. Out-group, we perceive those who aren't in our group disfavorably. Like I was mentioning previously, we can categorize groups based off of even things as arbitrary as sports teams' jerseys. And researchers have found that the in-group and out-group biases actually can apply when we look at, sports teams. We can even bring participants into a study and just give them like a red or a blue or a purple shirt or something. And you're going to automatically engage with the people within your group and hold higher opinions of them within those studies. So it is really, really interesting. So then we get into stereotypes and prejudice. We don't have discrimination on this slide, but that's also another component of this phenomenon. So when we look into stereotypes are beliefs and expectations that are based in somebody's perceived group membership. So when we stereotype things, when we use this term within social psychology, at the very least, these are inaccurate and unjust expectations of people, of individuals based off of their perceived group membership. Now, stereotypes can then lead to prejudice when those expectations and beliefs turn into attitudes. Now, stereotypes, prejudice, and discrimination are just three different components of kind of a similar idea, which is like unjust and inaccurate blank about somebody because of their perceived group membership. Now, when we look at stereotypes, this is expectations. When we look at prejudice, this is attitudes. And when we look at discrimination, this is behavior. And this could be individual behavior, this can be systemic, this can be, institutionalized or institutional, sorry. So again, stereotypes, we are just looking at these expectations that are inaccurate based off of perceived group membership. Prejudice is attitudes, and oftentimes when it's going to lead to treatment, that's going to fall under discrimination. So yeah, we're looking at basically any type of component of psychology in terms of thoughts, feelings, and behavior that's based in somebody's perceived group membership and is inaccurate and unjust. So these three ideas are a really great target for like compare and contrast types questions. I don't think, you might get some on the AP Psych test, but when we compare these three, like I mentioned, they are all going to be inaccurate based off of somebody's perceived group membership. And they're different in the domain in which they manifest. Some are cognitions, some are feelings, and then some are behaviors.
Awesome. So I think that is the end of social psychology. I think we might skip the Q&A to make sure we have time for your questions. But before we do that, I want everyone to pause for 1 second and give yourself a round of applause for getting through all 9 units.
Yay!
I hope now you all feel super confident, because I know if you all paid attention to all 9 units and went through that review packet and did the quizzes with us, I feel super confident in your ability to tackle the AP exam. So congratulations on finishing all 9 units. And anyone, I hope you all are feeling super confident, because I feel super confident that you all can do it after all of this and the amazing teaching from all of my co-teachers up here. From the amazing Jenna, who has absolutely killed it in putting things together and making sure everyone explains everything. So a round of applause for you guys, a round of applause for Jenna.
Oh, God.
A round of applause for the teaching team. And
so, what we're going to do is we're going to give you guys a 2-minute brain break. I'm going to pop the thing up on the screen in just a second. And then if you're back early from your brain break, start popping questions into the Q&A, start popping questions into the chat. We'll take a few minutes to address maybe like fewer than 5 right now, and then we'll pop over to our practice quiz. So I'm going to get started on all of that.
Cool. Enjoy your break. Enjoy knowing that you're done with all 9 units.
These breaks are never long enough.
They seriously aren't. And I don't know why I'm on the main stage again. Crowdcast just is wild sometimes. I'm gonna move Sean over too, so that, oh no, I almost just moved him back. This place is, I'm happy to soon be done with Crowdcast and my attitude about it. All right, so we're gonna take, let's see, no, unfortunately not
Another 2 minutes. No.
We're gonna do a very brief Q&A here, and we'll try to get through some of these questions. And then importantly, remember that tomorrow, we're gonna start with an FRQ, and then all we're gonna do is review each and every unit. So just because we don't get your questions answered right now or at the end of tonight, we will come back to this unit tomorrow. So just keep that in mind. And can our chat people pop some questions up in the main screen, please? Let's take no more than 5 minutes on this one. Why? Why am I back to the main? The heck?
And we both ended up back. All right. What is the reciprocity norm? So the reciprocity norm is another phenomenon in social psychology that when one person like does something good for you or gives you something, you feel like you should reciprocate it, or give it back or return the favor. Which is why I know for me, if someone gets me a gift for my birthday, I tend to get them a gift for their birthday. If someone does something nice for me, I try to do something nice back for them. And that's what the reciprocity norm is, in effect.
That. Nice.
I actually see Rakesh dropped in our backstage chat. Someone was asking about outgroup homogeneity.
Yeah, so that's just it contributes to outgroup bias. So it's kind of like a foundation of outgroup bias. So outgroup homogeneity is the assumption that people in our outgroups, so those who are not our in-group, are all like each other. So whereas we can see those within our in-group, my friends, my family, as unique individuals with their own interests, their own skills, their own qualities and characteristics, outgroup homogeneity says that outgroup members are all the same. So you hear this a lot in a lot of political rhetoric about oftentimes immigration-related political rhetoric, talking about outgroups that have all the same, they're all the same this, they're all the same that. That is outgroup homogeneity and contributes to the outgroup bias. All of these comments in the chat are so sweet. You guys are, let's go. Great job, everyone. So proud of you guys. Yay.
Jenna, can you turn on the captions for?
I sure can. Thanks for reminding me. Are they working? The heck?
Hello.
The heck?
There we go. Cool. So our next question I see is, what is the difference between diffusion of responsibility, de-individuation, and the bystander effect? So as we kind of talked a little bit about earlier, the diffusion of responsibility is the idea of when we're in a large group of people, we feel less responsible to do something in an emergency. We diffuse our responsibility to others. We think since we're with a bunch of people, somebody else will call 911, somebody else will get help. And the bystander effect is what manifests of that. So the bystander effect is when someone gets in a car accident on the side of the street, we're not likely to call 911 because we think that somebody else on the highway will, because there's so many other people to do it. We diffuse that responsibility, and that's the bystander effect. So those two go.
I'm gonna step in just real quick. So diffusion of responsibility is, yes, for sure, this is what we talked about already, going to manifest into the bystander effect. Diffusion of responsibility also has a lot of roles in other components of group dynamics and social psychology. So a lot of like rioting type behaviors or damage that can be caused during those are due to the diffusion of responsibility. So the group is doing this thing, I'm not. So it's going to be blamed across the whole group, like we were talking about with the January 6th riots and the insurrection. That's going to diffuse the individual's responsibility across a larger group. So this is a great phenomenon that has a lot of practical applications in different arenas.
Yeah, and that ties right into de-individuation as well, how mob mentality. If you can connect de-individuation and mob mentality in your head, that should help really clarify the different things, because de-individuation is the idea that when we're more willing to commit to do an extreme act in a group or to act more extreme in a group setting than we would as an individual on our own, because we can diffuse this responsibility to other members of the group. So yeah, diffusion of responsibility like manifests right into de-individuation and the bystander effect.
Nice. I
Cool.
said that in like Taylor Swift's nice.
Awesome. Do we want to take one more question maybe? See if there's anything popping out in the chat about social psych. Is situational cause kind of similar to self-serving bias and application? You can take that one.
So yes, in a way. So a self-serving bias means that we are going to attribute the good things that happen to ourselves, so to our dispositions, and we attribute the things that are bad to our situations. So situational versus dispositional attributions are going to differentially affect our self-serving bias. So yes, in a way, but again, that situational component will only manifest for our negatives when it comes to the self-serving bias.
Awesome. And with that, I think it's time for a mega, giant, amazing, spectacular, fantastic review quiz. What do you guys think?
Okay, so what we're going to have to do with this quiz is we're going to play, and I'm willing to hear it from you guys. I want to know, but we have two options. We can either play it like we would for an AP test. That means 40 seconds per question, and we might be able to get through all of them. Or we can do, you get a little bit more time on them if you want, and we'll finish them tomorrow. It's up to you guys. Somebody tell me what's going on over there, because I'm
seeing AP style in the chat.
That's what I was hoping for.
Yeah, that's what I was hoping for too. Yeah, great way to simulate what we'll be doing in the exam. A nice situational carries over.
All right, let me get to my
state-dependent moment.
Cram quizzes. You guys, do you know if Fiveable's free stuff allows them to make their own cram quizzes, or is that just through Fiveable Plus?
I'm not sure.
But so we make our cram quizzes through Fiveable's platform, and I think that you guys have access to them, but I'm not sure if it's through the free or the paid one. Maybe if we have a Fiveable team member in here, they can let me know. But
I'm pretty sure that they don't have access to it at the moment, but coming in fall, they'll have access to like a couple of them.
Love it.
Cool. And Fiveable does have 10 question quizzes for every unit on their website that you can totally take advantage of. Justin, I love it. I'm sensing group polarization.
And it's the second time that has happened. The second I suggest something and people agree with it, somebody's like, I sense group polarization. And
I love it.
I have to throw out, what if I just have great ideas? Could just be that.
Fair point.
It's into...
Hey, we're going to drop a link. You can scan the QR code. Let's do some AP psychology. And Selena or Zoe, I don't know if either of you guys wanted to still hop up and do the quiz with us. Totally up to you guys.
I'm getting my timer set so we can do this correctly.
I'm not hearing the music. Is it just me?
Can anyone else hear? Was I just sitting here by myself?
Oh, you guys can hear it? Maybe it's just me. Oh, it's just me. Dang it.
All right, let's start it. Does this mean I can hop back up into the wing up there?
Sure.
Okay.
Cool. Cognitive psychologists are most likely to study A, the relationship of, I don't know how to say either of those words, development. B, how infants move from basic trust to anatomy. C, the acquisition of knowledge, planning, and problem solving. Or D, how attribution of processes vary across cultures.
You're gonna laugh at me. I forgot to start the timer. I'll get it next time.
Jenna, do you mind turning the music down just a touch?
Even more?
I'm seeing from the chat.
Oh yeah, that might be old because it was blasting and I got it down. Let that. See if the new
Cool.
ones say that as well.
I'm so jealous because I can't hear. Oh yeah, it's still there. People are still popping up saying it's a little loud. But let's reveal the answer for right now while we see the
Wow.
acquisition of knowledge, planning, and problem solving. Awesome. 94% of you got that right, so I won't. Jenna, it's a little too loud, girl boss, Elle says.
It's
my
literally,
God.
do you see where this is? I cannot turn it down any lower. Let me see if it matters if I turn down my own volume, see if that works.
Oh my gosh. And Joshin is coming in clutch with the please release the music. We need it later for that state-dependent memory.
Okay,
Email
so
them
when I
now.
turn
I
down
bet
my
she-
own volume, is it better for them?
Oh, you fixed it. They love it now. All right, awesome. Number 2. If psychologists discovered that students who participate in more extracurricular activities have higher GPAs, this would indicate that extracurricular involvement in grades are A, negatively correlated, B, learned behaviors, C, positively correlated, or D, independent variables.
I think that it's independent variables, personally.
Zoe's
But
definitely not trying to
remember-
throw anyone off.
Oh yeah, no, obviously. But remember that negative correlation doesn't mean they're both negative, and positive correlation doesn't only mean that they're both positive.
Exactly.
You want
And
to
it's
think
important.
of it as a math problem that multiplication and that a positive number and a positive number create positive number, a negative number and a negative number create a positive number, but a negative and a positive number create a negative number.
Yeah, awesome. Positively correlated. 98% of you nailed that. 2% were tricked by Zoe. Zoe got them. But yeah, let's hop right into question 3. Li Wei is curious to learn whether students in his high school would be supportive of changing the start time to 9 a.m. He puts all 600 names in a box and pulls out 100 who will be asked to complete a survey to share their opinion. Which method is Li Wei using to select his subjects? And let me ask you, is this a good method? Once you answer this question, feel free to drop in the chat what you think. Is that a good way to select participants?
I think it's a good way. I think it's awesome.
Yeah. Assuming everyone responds as well, that's a very good representative sample and a good sample size.
Minimize bias.
Yes. We want to make that external validity as strong as we can. So external validity, generalizability, the ability to generalize our data to the greater population. And C, yes, a random sample. And it is not quite random assignment, because random assignment, that's used more in causal studies to assign people to a group. So random sample, that is the people that you're bringing in, the people that you're surveying. So that relates to external validity, or how generalizable our study is. Whereas random assignment is within, are you in the control group or are you in an experimental group? If you're in that's random assignment, and that helps with internal validity, and that helps make sure you're measuring the construct as accurately as possible. So cool, let's hop over to the next one. Blank validity is when a study shows a truthful cause and effect relationship. Oh my gosh, we just talked about this. So Maddie, I see your comment in the chat. No, because it's 9 a.m., so some participants may be more tired. That's not necessarily what the question was aiming at. The question was more about the sample that they're selecting. If it was some people took the survey at 9 a.m. and some people took the survey at 3 p.m., then yes, that would be a threat to internal validity. But since the question wasn't, even if everyone took it at 9 a.m., that would be perfectly fine. But yes, it's because, it's because 9 a.m. was kind of irrelevant to the kind of validity we were talking about. Oh no, this one tripped some people up. Okay, so let's talk validity. The two big kinds of validity that you'll talk about on the test are internal validity and external validity. Now, I want this to be another star thought, so I want everyone to make sure they get all these questions right on the test. I'm going to talk to you about some validity. External validity is how accurately do your results map onto the general population. So when you think of external validity, think of generalizability. That is the main idea of external validity. How well can your data apply to the outside world? And the way we get external validity is random samples. External validity has everything to do with the kind of people that you're surveying, the kind of people that are running in your experiment. So whenever you see a question about the kind of people, that's going to be external validity. When it's about recruiting participants, that's going to be external validity. When it's about how generalizable something is, that is going to be external validity. Internal validity is how well are you measuring what you're trying to measure? How well is your results going to show what you're trying to find? So when we're talking about the relationship, when it shows a truthful cause and effect relationship, it is internally valid because we're talking about the relationship that we were looking at. We're not talking about the participants. We're not talking about how the participants were selected. We're talking about the relationship that was observed, which is internal validity. Internal validity, I want you to think of random assignment. Random assignment is how you're assigned to a group. Are you in the control group or are you in an experimental group? And that's how we find relationships, truthful relationships. So that is what internal validity is. Whereas external validity, I want you to think of random sampling. So random sampling is generalizable, is external validity. Random assignment is relationships, is internal validity. And then face validity, which I see in the chat, how well does something assess the construct like on its face? How well does it assess something as it appears to be? Cool, so those are the two big ideas. Oh, sorry, the three big ideas on validity that you should know. All right, let's go to the next question. And let me know if I'm talking a little too fast because I know we can't get captions since we're not on the slide. So just let me know if you need me to slow down talking. Cool. Which of the following correlation coefficients represents the strongest relationship? A, negative 0.25, B, 0.13, C, negative 0.98, D, 0.92. Oh my god, 9.2. I don't even think it's not even possible to have correlation that high. It cannot go above 1. Awesome. And Zoe, you were like the negative positive superstar with the last question, so I'll have you explain this answer if you don't mind.
So the correlation goes from -1 to 1. And the relationship is most strengthened at -1. So.
Yeah. So the relationship, when you're thinking about how strong the relationship is, forget about the positive or negative signs. That's just the numbers that you're seeing. So if D was 0.99, that would be stronger than negative 0.98. But nonetheless, when you're thinking about strength, take the absolute value of each. The absolute value of each. So that means take away all the signs. Whichever number is the closest to 1 is the strongest relationship. All's at a negative. Can I talk in 2 times speed? My parents tell me that I talk in 2 times speed, but no. So all that negative means is that the correlation is negative, so it's a downwards correlation. They are negatively correlated. It's still stronger. Like if I have paper around me.
You know what? I can jump in here. Let me bop down for a second. Bop to the top or whatever that song was. So when we have correlations, wow, I'm on main. I hate this. When we're looking at correlations, think about absolute values. We know an absolute value means that number, whether positive or negative, we're going to be looking at just the number. It doesn't matter. So the strength of the correlation is going to be measured on a 0 to 1 scale. Absolute value. It does not matter about the sign yet. Correlations closer to 0 are weaker. Correlations closer to 1 are stronger. So we know that the 0.98 is going to be stronger than the 0.13. Again, we're not looking at the sign in front of it, whether it's positive or negative. So when we just look at strength, take the absolute value. Now, the reason why the negative and the positive pops in is the direction of that correlation. If I cannot see that.
Is that visible?
If the variable increases, if the variables increase together, or if the variables decrease together, it's a positive correlation. If the variables go in different directions, one goes up and one goes down, that's a negative correlation. So if they both go in the same way, it's positive. If they both go in different ways, it's negative. And that's the easiest way that I can explain it.
See if that's better. I tried kind of drawing it. If you can
Perfect.
see that.
Yeah.
So
The negative.
yeah, that top one, that's a positive correlation because both variables are increasing together. That bottom one is a negative correlation because you can see that the as the x-axis increases, the y-axis is decreasing. So values, if you put your finger like on any one of those values, the corresponding point on the x-axis is going to correspond with the point on the y-axis, and it's going to decrease down the y-axis. So that's like the graph I can give you.
Sometimes a piece of paper and a whiteboard just makes with stats makes all the difference sometimes.
All right, let's keep it going.
What is the committee that reviews research involving animals? The
Oh, I know
CDC,
this one.
OSHA, IRB, or IACUC?
It's IACUC. That's the how you pronounce that one.
IACUC.
Mm-hmm.
It's definitely OSHA. I actually watched a conspiracy theory about the 1971 Charlie and the Chocolate Factory movie
What?
that involves the OSHA violations and how Willy Wonka was trying to give away his factory in order to avoid fines from the OSHA corporation.
Look at that. Most of us got IACUC.
Nice. I honestly did not know that one.
Yeah, so that's for any work that's done with animals or for non-humans. And then we talked about the IRB earlier. So the Institutional Review Board is for human research.
Humans.
Oh my God, somebody
Cool.
said, when is my show and tell happening? But when we're done with the quiz and we go back to Q&A. So we'll keep going on the quiz. Thanks for reminding me.
Awesome. Which gland is often referred to as the master gland because it controls the activity of other endocrine glands?
This was
This is
my original elimination video question.
That's right. So
And-
throwback, do you guys pay attention to Zoe all those nights ago?
I actually didn't end up doing that one,
Oh,
but I know
just
the
kidding.
answer.
But yeah, so this is a great time also to use the word strategies. Or some words look different than the other that make it very clearly eliminable. Is that a word? Eliminatable.
So I see some people in the chat grumping because we're taking 5 minutes per question, but we're explaining the answers. You're still only getting 40 seconds to answer it. So
Awesome.
just a reminder that the time to answer the question is still the same, 40 seconds. And then we're also explaining the answers.
Cool. Pituitary gland. Most of you got that one right. So I want to make sure we can get through as many questions as possible so we can blow through. What section of the brain controls the endocrine system? Ooh, we're on an endocrine system grind right now. Charlie in the Great Glass Elevator. Huh. I've not heard of that one.
That was a wild book.
So these answers are flying in.
I never started this timer. I thought I did. We'll just
Honestly,
wait to see it.
yeah, I
think
say-
we'll reveal it.
I say reveal. Let's go for it. The hypothalamus. And I'm actually going to turn this over to our resident brain person to explain.
So the hypothalamus is it's a structure within the brain that we know of very well. It controls the pituitary gland, and the pituitary gland is what secretes, the hormones that travel throughout the whole body. The hypothalamus, so the pituitary gland is often seen as the master regulator, but the hypothalamus actually controls the pituitary. It secretes hormones as well. So it secretes, even through things like fight or flight, that starts amygdala to hypothalamus to pituitary, the HPG axis, the HPA axis, all of these are starting at the hypothalamus.
Awesome, cool. I'm seeing some requests in the chat too to just start going through them with less explanation. So if that's what you guys want, we can just flow through them. You can throw questions in tomorrow.
It's different because other people said they still wanted to get them explained. So
Oh, JK. People want explanation.
Please explain.
Okay. Well, we'll keep explaining.
Yes. All right. Let's move to the next one. I like the all caps.
What is the neurotransmitter responsible for the activation of skeletal muscles and is targeted by the toxin in black widow spider venom? Oh.
This
Okay,
one
we'll
is
explain.
fun.
I promise.
I love this one. We're gonna have a little neurotransmitter review for you tomorrow since we got eaten alive for not putting them in on night 1. So we'll have them for you tomorrow. But
Actually-
hopefully you've learned this in class and you've reviewed it before, and we'll just give you a little review tomorrow.
Yeah.
I actually gave a mnemonic about this earlier in the chat. If anyone saw it.
Can you remind us of it?
So you know that acetylcholine is focused on muscle movement because the abbreviation of acetylcholine is ACH. Think macho.
Oh, I love that.
I love it. I love it.
Yeah, acetylcholine is it's the predominant neurotransmitter in our peripheral nervous system, and it is important for all of our skeletal muscle movements.
Perfect. Keep it moving. Moving and grooving to that music, which I can't hear sadly still.
Oh no.
What is the neurotransmitter targeted by such as Valium and Xanax?
Benzodiazepines.
Yep, that. Which enhances its activity in the brain and can cause sedation, anxiety relief, and muscle relaxation. Keep it PG.
Look at that. Almost a majority. Well, technically a majority. So we talked about these in the clinical unit. The anxiolytics, the anti-anxiety medications, those target GABA. GABA is the primary inhibitory neurotransmitter of the central nervous system, and that is going to slow down the central nervous system activity. Basically, think about it like literally your anxiety is just like all up in your head, which it is. It's your neurons firing very rapidly, and benzodiazepines, which are anxiolytics, are going to just that way down by activating GABA. Also is the same neurotransmitter in things like alcohol, for example.
Sophie was killing it in the chat with a acronym GABA, get a break adjustment. So that helps you think about it.
I love it.
And then Erin, what does GABA stand for? You do not need to know what GABA stands for.
You
GABA is
don't.
the only way it'll appear on the test.
I'm gonna be honest, like I barely know how to say it. You don't need, we all just call it GABA. All right, let's do it.
In general, damage to blank disrupts speaking, while damage to blank disrupts understanding of language. You know, this is like, Jenna, when you were saying the other night, like the perspective in retroactive areas, how that always gets you. Broca and Wernicke's areas always get me.
Proactive and retroactive interference will never stick in my brain. I'm sorry that that's what's happening for Broca's and Wernicke's areas for you.
But I think I recall this being a question on my AP exam, so good to know.
Areas are major. Psychologists love to talk about them.
I remember my professor too can never get them straight. Oh my god, 97% of you are not stumped by it. So
we'll just move on from that one then.
Hop right over to the next one. What is the imaging technique that uses radioactive tracers to measure brain activity, which can be used to study brain function and activity in real time?
I saw somebody post this in the chat at the very beginning of our time together tonight. Oh, I like this example. Somebody said Broca Spoca.
Oh, wow, there's a lot of good ones. Yep, Broca is boca, which is mouth in Spanish.
Rakesh says
equals
Broca is
broken
blah,
jaw.
blah, blah, and Wernicke's is, what did you say? Even though it's technically it's pronounced with a V, but it has a W. It's like the Wilhelm Wundt kind of thing.
PET scan.
Pretty decent.
I'll refer to our resident brain expert again to describe this one.
Predominantly the AP, so they'll probably ask you one question about brain imaging techniques. So there's a lot of different ones. So there's the EEG, which is the electrodes on the head that measure literally the action potentials of your neurons. CT scans. CT scans are similar to X-rays in what we can get. PET scans, we do get that radioactive tracing, so you get a lot of contrast, so you get like a better image. And then the other one that would be important for psychology is fMRIs. So fMRIs actually are a series of different images that get squashed together. They get squashed together to show where the brain blood flow is. And the assumption is that areas that have more flow and more brain flow are going to be active. So that's why it's a functional MRI.
fMRI pictures are so cool to look at.
They're
That's actually
really cool.
That's what my lab, like, we use fMRIs. I actually got an MRI certification to do it, which was so much fun.
That is cool.
Yeah.
All right, next one.
Fun fact about an EEG, I will never forget what that is, because one time I participated in a study, and it was the worst study I participated in my entire life, because they put this giant cap on you and they like twist like the little like gel thing. Oh, I would not recommend. But which brain structure is responsible for regulating body temperature, hunger, and thirst? Ooh.
We talked about these yesterday, I believe.
Mm-hmm.
So, and it was kind of a tough one for us yesterday. So hopefully we studied that a little bit. And let's see.
Awesome. Let's see it.
Good job. So much better than
Yay.
yesterday. Awesome work.
Killing it. Which functional area in the brain controls hearing?
The lobes. Let's
Oh,
look
good
at
practice
the
with the
lobes.
lobes. Bonus points if you want to drop in the chat what a different lobe does.
Heck yeah, do that. And then we can talk about, we'll see how people do on this one, because I think lobes are like kind of basic, but if we need
I think they're pretty.
if we need to take the time to do it, we can.
Cool, let's see it.
Nice.
Temporal
Okay. We're
lobe,
pretty
killed
good.
it.
Pretty good on our lobes. If we're not good on our lobes, front is in the front. Occipital is ironic because it's all the way in the back. It's for your vision, but it's all the way in the back. And then the only way I remember parietal and temporal, even though I've been doing this for way too long, parietal, P comes before T. So your parietals is on top of your temporal. That's the only reason I remember them. And I've been doing this for a long time. So
Interesting.
all right.
And cerebellum is just like tucked right under. It's like,
Yeah, cerebellum is like at the, where's this little dude? I don't know
that's
why.
a lot of
Yes.
motor skills and
Frontal.
movement.
Front, occipital back here, cerebellum back here, and then parietal and temporal.
Awesome, cool. What is the absolute threshold?
This is in sensation and perception.
Yes, super important. Ugh, what's the name of the effect again? That is it the McGurk effect? Is about absolute thresholds?
I have no idea what you just said.
Maybe not.
Perfect,
Yes,
the
the
smallest
smallest-
amount. Sorry, go ahead, Sean.
Oh, yeah, perfect. The smallest amount of stimulus we can detect. Perfect.
The
Keep it moving.
next closest was the highest amount. So absolute is always just going to be like the bare minimum. So just kind of think about it that way. All right.
Which type of depth cue involves the perception of distance based on the convergence of the eyes?
We talked about these, I think, night 1.
Yep.
I'm remembering correctly.
Perception unit 3, because we had a whole slide on binocular and monocular cues.
Cool. No, I'm bad at eye stuff. Oh no. Sorry, Carmela. Hopefully we get this one.
You know, when I would take my exams that asked about binocular and monocular cues, I'd just cover one of my eyes and do the thing in front of me and see
Just test
it
it.
in real time. Yeah, I'm like, which
Yeah.
one makes the most sense?
Hey, good job, you guys.
Awesome.
I believe it has multiple names. L. I don't know what your name is, but someone asked in the chat, isn't it called retinal disparity? But because it's a binocular cue, it's called either binocular disparity or retinal disparity.
Okay, so accommodation is so very few of us answered with accommodation, but it's that your lens changing for incoming information. Because somebody asked, can we explain this one? They're a bit confused. Zoe, wasn't this your section? Do you want to take over on this?
Sure. So relative size is that something's like the size is dependent on how far away from you it is, I believe, or in terms of and then interposition is that something is that something is closer than another thing because it's blocking the other object. That's interposition. And then accommodation has to do with your schema, so that's completely different. But accommodation is basically that your schema, you think something is part of your schema, and then assimilation is adding something to your schema in a different way.
Awesome. And let's do, since we're running out of time, one last question all together real quick, and then we will.
I also wanted to let everybody know, I'll just be here for the next however long it takes, just going through these questions with you. I'm going to give you guys 60 seconds per, and I'll just sit here. No explanations because I'm not keeping the live stream going, but I'll keep going on the quiz for you so that you guys can practice. But again, unfortunately, there's not going to be any explanations. Can you keep it 40 seconds like the AP exam? Yeah, sure. I'm going to have to be sitting here like, but I got it. All right.
Awesome. Jenna, appreciation real quick. She is the best person ever for doing that. Everyone go appreciate Jenna in the chat and tell her how much we love her.
I'll show you my, what is it called? My show and tell today. If you were at our previews, you would have seen this, but this is my Freudian Sips mug. And then on the back, it says, when you say one thing, but mean your mother. I did not buy this for myself. I would just like to clarify. I know that's 2 nights in a row of Freud gear. This was a gift that I cherish deeply. But I did not choose it for myself. So leave your questions in your notes so we can tackle them next time. We will see you all tomorrow to wrap up everything. We're going to start with an FRQ, so come in prepped to write your FRQ, and then we are going to go through each and every unit, times 4 questions, and we'll get it going. So thank you all for coming again, and I'll be here going through that quiz, 40 seconds-ish, roughly. Don't get mad at me if it's a little bit over, because I can't multitask a lot of things, all right?
Okay. Congratulations, everyone, for making it through 9 units. You're all amazing.
Bye.
Jenna,
Thank you guys so much. Have a nice night.
See you tomorrow.
Have a great night, everyone. Thank you so much.